Be a nice. All right, welcome guys. Welcome, welcome, welcome. Today is another interesting day, and we have my good friend. He has been a very good friend of me, a professional colleague. We've worked together for a long time, and he has, proven over time to be a man that insists on excellence. He insists, that he must have excellence in anything that he does. His name is Dr. Johnson Ogundare. Dr. Johnson Ogundare has been in many, chairs. He has been a leader. I would say for the most part, since I know Johnson, since we became friends, Johnson has always, been a leader anywhere he goes. Anywhere you see Johnson, you will see leadership par excellence. He has been a great guy. We have all, worked in different associations, different groups. We've done operating room together, at some point in National Hospital. I think that was the first time we met, and I saw something in him. When the first time I met him, I knew that he's a man that likes leadership, and when he leads, he leads with excellence in mind, and there's an integrity that follows that name, Johnson Ogundare. Anywhere you mention it, you will see people, relating it to excellence wherever he is. So, and also, I want to say something. Sometimes we tend to believe that nurses need something from outside of nursing to change the nursing profession. I would say no. Nurses have all that it takes to change the nursing profession. Dr. Johnson has been a change agent. He has charted a new course for different area and spheres of nursing. In fact, he is the chairman, I would say he is the president of SNEMIS Nigeria. SNEMIS Nigeria was an association that he was a brainchild of Mr. Johnson, Dr. Johnson, I would say. Dr. Johnson actually came up with this idea because he saw a gap in the training of nurses in perioperative area, and he cashed in on it. He started, sensitizing people about it, and before you knew it, SNEMIS Nigeria has SNEMIS Ghana, there is SNEMIS Africa, there is SNEMIS everywhere. So it's been a great institution that has been helping a lot of people in the perioperative area. And not just that, this very guy I have here, this gentleman that I have here, he tries to stay humble most of the time, but he is also one of the AORN leader. If you are in the perioperative nursing, you will know what AORN stands for. Association of Operating Room Nurses in the US. He's one of the leaders in his chapter here in the United States. So he's not just leading in Nigeria, he's also leading in the US. That's why I said wherever he comes, he's also, he just distinguishes himself as a leader, and people see that leadership skill in him, and they get him into positions where he can actually, let people know or lead and contribute his quota to the development of nursing in different areas. So, Mr. Johnson, we are more than happy to have you today. Thank you for, accepting the invitation out of your busy schedule. We know it was not easy for you. Thank you so much for being here. We
Thank
are
you
we
for
are,
having me.
we are a group of nurses from different places. I would say you saw many people are coming from different areas. They are coming from different areas of the different continent. I would say, and one of the things that we do here is we try to get information across to nurses who are still in the process of coming to the United States. And I know, Mr. Johnson, you were once in this position. You were once in a
Yes,
place where you wanted to come to the United States. So,
right.
first of all, I would say let's do a proper introduction. How are you doing today? Welcome to the program. How are you doing, sir?
Thank you so much for having me. It's a great honor and a pleasure to join the fantastic nurses, trailblazer nurses, uh, on this platform. And thank you so much for giving me the opportunity to speak with our professional colleagues. Always feel excited when I'm within the midst of our people, because our ecosystem is so large and is so robust, and it's so interesting to see how various nurses are doing great things, influencing the patient care across the world. How am I doing today? I'm doing good. I'm talking to you guys from the city of West Fargo in the state of North Dakota. When they say Fargo in America, it's Fargo. It's a place that is very far to go. So I'm very far from Oga Decency. Oga
Yes,
Decency is very far. America is so
yeah,
big, and
that's true.
Fargo is a very far place to go. We are close to Canada. So I have code. So you guys, I'll try my best to speak where, because here is very cold. We share border with Winnipeg, and most times we drive to Winnipeg from here. So decency, if you come visiting, we should take a road trip to Canada,
Sure,
together. Yeah, we should
sure.
take a road trip. So we just drive, we go back. So it's just that I'm having cold today. But even with that, I'm so excited to speak with you guys, to hear from you, and most importantly, to encourage you based on the vision and the mission for what Decency Academy has been doing. And I think I must say this before I'm giving the opportunity to finally talk to you guys, that Decency Academy is a fantastic, platform, a fantastic organization, helping a lot of international nurses, I don't want to say Nigerians, to achieve their American dream. So kudos to you, my brother.
Thank you so much.
We've been together for a longer period of time, but and it has been a blessing to have you in this profession as well. You are doing great, and I have my respect for you. So, and
Thank
I
you,
want to
boss.
thank everybody. You were welcome, Brad. I want to thank everyone for joining today, and I hope that when I share my story with you, it's going to interest you, and perhaps it's going to possibly change some orientation about some people. It's not, my story is not that so kind of, it's not scary, but it's more kind of interesting and challenging one, which I hope that it will inspire you, and to know that where you are right now is not a pause, but it's preparing you for greatness. Thank you so much.
Thank you so much. I appreciate you so very much. So now that you've done that and you went a little bit into my next question, before you share your screen, I know you were once in Nigeria. I even knew that before you even came on this EB3 pathway, you were a regular visitor to the United States. It was not new to you. You've been here a few times. But I just want you to tell that story by yourself. I don't want to preempt you. I don't want to put words in your mouth. Can you just give us a little background of your nursing career in Nigeria? What prompted you to take on this challenge of coming to the United States and how that journey of coming to the United States was for you?
All right, thank you so much for that question. Um, so I started my nursing career in Nigeria. I think, after my high school, that is my secondary school, uh, my father had always wanted me to study medicine like my elder brother. Uh, and I was looking at our experience, my family experience, when my elder brother was in medical school. If there are people who may understand the word suffer, we passed through a lot trying to support my elder brother in his medical school career. So I was just being compassionate about, empathical for my parent, that it's not that I cannot study medicine like my brother, but I need something that, um, if I do it, I can be able to take care of myself. I doesn't need to take a toll on my family finances, because my brother was not like working at that time. So I did A level. I'm passionate about study abroad. I did A levels, and I wasn't looking at studying in Nigeria, my university in Nigeria at all. So after my A level, I got admission to the UK through UCAS. I don't know if people still remember UCAS, UAC.
Yes,
That is the one
yes,
that do admission for the UK,
yes.
and I got several admission to different universities anyway, medicine, nursing, just like my father wanted it. But at the same time, I applied for JAM. So, but my father only wanted me to study medicine, so I put medicine first, nursing second choice. But to cut the story short, with my admission to study abroad, my parents could not afford it, you know, and I said I'm trying to consider them. So I wanted nursing. Uh, so there wasn't money to come to the US. I got admission to Albany State University in Atlanta, Georgia, here in year 2000, and I was to study nursing. In fact, everything was so like good, like ready to go, but there was no money to cut the story short. So I went back to the university, and by the time I came back to the university, because I didn't accept my acceptance, I didn't accept my admission to University of Ibadan at that point. So the admission was closed, but I found my way into the Department of Botany and Microbiology. That was that very day I cried. That was the day my father and I like, because I was like, my father needs to help me to push for nursing. But I found my way in the botany and microbiology. After 100 level, I was to cross to nursing. I was to cross to medicine because of my CGPA. And then my department said they can release one of their best students in to go to other departments. So because of that, while I was in my study room where we used to study as students, we call ourselves 7.8 pointers, because UI used to use 7.0 CGPA then. And I got that information about Oyo State College of Nursing, LLA, now a degree awarding institution. So I took the form and I went for the exam, and I got admission into School of Nursing, LLA. So when I got there, I was surprised to know that the school wasn't a degree awarding institution. So it was a College of Nursing. So it was just at the level of the Oyo State legislatures to pass the law. So that was when they announced it that time. So because the story short, I took it upon myself and I finished from Oyo State College of Nursing, LALA, Ibadan. And after that, I applied for a job at UCH Ibadan, University College Hospital Ibadan, for those people that are from Nigeria. And fortunately for me, I was given as a single qualified nurse, I was given the offer to work at UCH. So I started my career on the floor. I work as a neuro nurse on neuro floor, like med here. So neuro floor. So I was there for 1 year before I was moved to the operating room. And in Nigeria, before you can work in the operating room, for those people that are coming to the US, the culture is different. The practice is different in some ways. And I will explain that as we go on. So when I moved to the OR as a single qualified nurse, I wasn't a perioperative trainer. So it was a big challenge for me to even fit into the operating room practice in my hospital, that's Nigeria. Not that I did not want to learn, but I was eager to learn, a young chap interested in technology, but there's something they call local standing. So in UCH OR, if you are not a peri-op nurse, there are certain cases they can allow you to do. So you only work in the PACU or the patient holding area, that is pre-op, or you work in the post-op area. So from there, UCH sponsored me to attend my preoperative nursing school at the same University College Hospital, but I'm grateful to University College Hospital for sponsoring me. So after that, I finished my preoperative nursing education at UCH Preoperative Nursing School, Ibadan, in year 2011. And but at that time, I've been working in the OR before going to the peri-op school anyway. So apparently, I know everything I needed to know, but I need the license, I need the certification, and I need that ability to belong to the team. Because if you are not a peri-op nurse, then there's something they call local standing. You can't even contribute, you can't even talk. They will tell you don't have local standing. That's just by the way. Then after that, I worked with UCH for a couple of years. I did about 7 years. And passion for uh, technology. I so much love innovation, medical technologies, anything that can improve patient care, and anything that can actually improve proficiency of even operating room practice. I am so much passionate about it. So when I was at UCH, I was kind of lucky to be distinguished as one of the amongst so many fantastic leaders that trained me, and I'm grateful to them. I have so many mentors. So I was opportunity to be one of the best nurses in my department in the OR. And because of that, I was selected to join the cardiac team, the open heart surgery team. And I was as a perfusionist. So why I'm saying this is that it's a big question this is just asked me now because I've done so many things. So I work as a perfusionist at UCH Ibadan, training perfusionist. That's the person that works with the heart lung machine, when we do open heart surgery. And I was thinking maybe UCH government can sponsor me because I tried to look for university here in the US and I got admission, but it was expensive. UCH cannot sponsor me. So I decided to leave UCH to join GNCI, they call it a GNC International. GNC International, I give I draw my card for my CEO, Madam Omasie, for giving me the opportunity to work at GNCI as the clinical application specialist for Olympus endoscopy. That is a medical endoscopy and a surgical platforms. So I was working in medical equipment company, that's GNCI, which is a turnkey hospital equipment company. And with that, I was opportunity to know a lot about equipment because when you work in medical equipment company that sells equipment, you know a lot. And for me, being a clinical application specialist, I focus on endoscopy and minimally invasive surgery. And I was able to travel. Maybe some people here like probably have seen me in their facility before. And while I was doing that, there was a need for me to compare the standard of practice in Nigeria to the developed country like the US. So while I was doing this medical sales, I had the opportunity of meeting some great, fantastic Nigerian surgeons in diaspora coming to Nigeria, wanting to start their own practice. And then with that, I met Professor Wale Sulaiman. I drew my card for Professor Wale Sulaiman, who happens to be a professor of minimally invasive spine surgery. And he facilitated my first, what do you call it now? My first fellowship. I happens to be the first international nurse to have fellowship in neuroendoscopy and spine surgery at Oshne Medical Center in Louisiana. So when I got here, I wish I had some pictures to show you guys. The culture, there was this cultural shock. I know that we're still going to talk about that. The way they do things and things like that. And as a nurse, I was expected to I'm going to scrub. The nurses scrub. They do things like we do back, especially back in my country. Forgive me if you are joining from other country. I'm going to be referencing, Nigeria as I talk. So please, because I'm from that place, and maybe Ghana. So the first time I told them that I need to scrub, and the nurse you can't scrub because we have scrub techs, and here we don't scrub, only scrub techs scrubs because they have been trained to do that, and they have been licensed. I mean, they have been certified rather, because they don't have license. They have been certified to do that. And I said, but I'm from Nigeria because why I'm here is to learn how to scrub because when I go back, I need to start scrubbing. And it may surprise you to know that they allow me to scrub, but they didn't allow me to pass instrument to surgeon because I'm not a scrub tech, and that's the policy. So I just want to prepare your mind that though things are changing now, right? But then I couldn't pass that. I'm talking about 2017. I couldn't pass instrument. But I would just scrub with the scrub tech, learn everything. And that was just a story about New Orleans. It was a fantastic place for me. It was a great experience, very challenging, but great experience. I will still share some of the challenges with you, especially when it comes to communication and come to some of the cultural shock when it comes to adapting to the US, because I don't want to jump over the tax Decency has given me. And because of that, I'm so passionate about that. So when I have the opportunity, I keep pushing. So I also came to US another time to do similar thing with a assistant professor Akui Asonbang. Professor Akui Asonbang is associate professor at Harvard University. And fortunately, I had the opportunity of also giving a lecture at Harvard some times ago. And they're talking about it. Colorectal cancer in Africa. So I was opportunity to facilitate that. It was exciting to be mentioned as one of the facilitators at Harvard University. So it was so pleasing. So I joined Dr. Professor Akui at Rhode Island Hospital and the Miriam Hospital for endoscopy because I'm passionate about endoscopy. Like this NC said, I love endoscopy and minimally invasive surgery. And I will tell you why. Most of you that work in the OR, or most of you that are intending to come to the OR, will see the reason why minimally invasive surgery is much better over open surgery. Because one, the patient doesn't have too much of pain because it's a keyhole surgery, right? Patient doesn't have pain, and because of that, recovery is faster. Patient can recover on time, and you don't have to keep the patient in the hospital for too long. So there is reduced hospitalization because patient can be recovered speedily. So patient doesn't have to stay too long when you do open surgery and you wait for patient to spend maybe 4 weeks, 3 weeks in the hospital and waiting for bowel movement or something like that. This, the patient can go home that same day. And it's good for the hospital. Hospital can make more money. There's return on investment. Even though those equipment are very expensive, but the hospital can make more money because the same bed is one patient supposed to use for 6 weeks or 8 weeks. The patient doesn't even have to stay there a day. They can use that bed for another patient, for another patient, for another patient, and the hospital make more money, right? And in terms of ergonomics, the ergonomics is so good for the surgeon, in terms of, minimally invasive and things, even though the training is rigorous, it's very rigorous in terms of dexterity. They need to take their time to learn it. And once they know it, everything is really good. So this is just one of it, and there's reduced infection rates because, when you do make a large incision in open surgery, you are exposing the patient to a lot of microbial organisms within the operating room, and even when they get to the recovery area or when they get to the med surg or post-op area, aside from the patient indigenous factors that can cause surgical site infection, large incisional site is another factor that can predispose patient to surgical site infection. So minimally invasive surgery, because of that small incision, patient doesn't come down often with infection. So that's why I'm passionate about it. So, and I bless God that I want to say that I climbed to the highest peak of my career in Nigeria before coming to the US. But even with that, there is a need for me to move. Because everything I saw each time I come to the US visiting is telling me that you need to be here in the US. This is your dream country. I love my country. I wrote it on LinkedIn some times ago. I'm passionate about my country. When people say, why are you going back to Nigeria? Every time you come, are you crazy? Are you stupid? Are you working in Nassau Rock or are you working with oil and gas? But there was a need for us to develop capacity building in Nigeria through SNEMIS. And thanks to Decency, Decency is the pioneer chairman of SNEMIS Nigeria. And thank you for that great job for that period of your tenure. So I was going back to develop capacity, train more nurses in endoscopy and minimally invasive surgery in Nigeria because in Nigeria, there is no formal training for us. Even when you go to preoperative nursing school, even most of the teaching hospitals don't have this equipment, even to train doctors. So doctor needs to spend their money to go to India, go to the US, go to the UK to learn this stuff. So we needed to train ourselves, and that was what uh, I didn't come to the US or stay in the US at that moment. But when the time came for us to leave, uh, then the SARS issue happened. So you might have different reasons why you want to live wherever you are right now. You might have different reasons. I'm here to just share my own experience with you. It might not be the same with you, but some people might pick one or two things. But what I want you to take from this conversation today is the fact that this is a dreamland. And the fact that you are waiting right now is not the end. It is what? It is preparing you for greatness. And that's why we're even having these opportunities of this conversation today. So thank you, Decency. I don't know if I've said more than
No,
enough.
you did justice. You did justice to the question. You covered every area, but I just want to talk to our viewers. We have over 80 people on the show right now, but I just want to let you guys know. You see, Johnson, there's something he said. He said he's gotten to the peak of his career in Nigeria, but he still wanted more. You understand? So a lot of people that talk to every day, most of them, in fact, today, I was talking to a man who does not want the wife to come to the United States because, according to him, he said he would not like to raise his children in the United States. But when you consider the arguments that most people are making, the only thing I see there is that you've not been here. It's only when you come here, then you can compare the two coins. You cannot compare what you don't know. You understand? So Johnson came here, even though he has gotten to the peak of his career, he knew that this place was the place for him to be. I don't know if that is enough in a motivation for you to keep holding on. Don't worry about what is going on, retrogression and whatever that is going on the air. It happened during my own time. I don't know if it happened during Johnson's time, but we had a wait
Yeah,
time.
happened. Yes.
You had a wait time. There was a time that it got to everybody had to queue up and wait. You understand? But what happens at that point is if you have what it takes to come in, once the door opens, you'll be among the first to come in. But if you do not have what it takes to come in, when the door opens, you start gathering yourself to go and take the NCLEX. Before you come back, the door might be shut again. You
Yeah.
understand? So it's always good to get ready, wait on the queue, and then, Johnson, thank you so much for that. He did so great. In fact, I knew that some of the things you said are short, very short of who you are, because you might have forgotten most of them. Maybe now you're
Yeah.
recollecting
Yeah.
some of the things that you've done in the past, but that's
Yeah.
not withstanding. I just want you to now go into your presentation. I know you have something for us about the topic that we gave you to discuss with us today. I would like to give you that opportunity to, go share the slide with us and just take a few moments to give us a presentation. And at the end, we're supposed to have a question time. My people like to have, a good number of time to ask questions. So they will be asking some question at the end of your presentation. So thank you so much, Dr. Johnson.
Sounds good. Sounds good. Thank you for having me. Let's go into the slide. All right. So, dear professional colleague, once again, I want to thank you for uh, the opportunity of joining you guys today. And I want to celebrate you and congratulate you on your success. And I want to start, by quoting what Nelson Mandela said. He said, after climbing a great hill, one only finds that there are many more hills to climb. So the NCLEX was just once what? Just one hill. And perhaps your English proficiency is another hill. And the next journey, the next hill is your journey to the United States. And I want to see this journey as a journey of transformation, adaptation, and purpose. Because I know before either you, if you are single, or either you and your family, if you are married, decided to embark on this journey, NCLEX journey, it was for a purpose. So I want you to see this as what? As a journey of transformation, adaptation, and purpose. And I'm bringing greetings from my wife, my beautiful wife. My wife is a professional nurse as well. And she is a perioperative nurse. We both work in the OR. In fact, as a matter of fact, we go everywhere together, you know. And I have a question here before, a Snapchat question for you, but Decency already did that. And where you were joining from and things like that. I would have loved to ask you to share with us your best weather season of the year. I don't know where you are joining from. The weather season in the US, in Europe is different, maybe from the Northern America, a little bit slight different, but like kind of totally different from Africa, for example. So even in Africa, we have dry season, we have rain season, and perhaps we have the Harmattan season. So I don't know which one is the best for you. And the reason is this, why I'm asking, is the fact that, you need to brace yourself depending on the area where you be, the city or the state where you'll be coming to work or live here in the US, especially when you first landed in the United States. So if you want to share that with us, your best season, if you like cold season, if you like when it is hot or sunny, you can put it in the chat. Why are we here today? We're here today for me, Johnson Ogundare, to share my journey to the operating room at US. Decency asked that question earlier. I think I've shared a little bit about my journey to the operating room. Just to add to it, a few things I want to say is that most of the first minimally invasive surgery in Nigeria, I was there. And I also work as a first assist to most of the visiting surgeons from the US, from the UK, and from India. And I was always on the plane going to most of the hospitals to do this surgery. And that was informed the part of its name is that we cannot be everywhere. Decency cannot be called to go everywhere every time. I cannot be everywhere. We need to bring more people on board so that we can have nurses who can serve the population, the great Nigerian population, in terms of the patient that might need their surgical services. So today I'll be talking about benefit of robotic surgery over laparoscopic surgery. I think Decency gave me this task because I'm a perioperative nurse. But even with that, for you that are not perioperative nurses, I want to believe that you still benefit from this conversation today. It might be your take-home point might be from the cultural adaptation to the US. The other person might be from clinical adaptation to, I think everybody needs to understand the clinical adaptation to the United States, as well as the cultural. And peradventure, if you are the one that you don't want to work and so-called quote and unquote work and die in the US, it is important for us to balance everything out. So these are the things that I'll be sharing with you today. It's not a presentation slide, it's all about more conversation. I'm even very good with having an open conversation with everyone on board. But it is important for me to just put a picture for you guys to follow, because I don't know if the network is good, so that some people, when you are not hearing me clearly, you can probably follow the slide and I just have an idea of what I'm saying. So my journey to the United States or to the operating room, it started with a vision. And it's a vision to make a difference beyond geographical background, boundaries, or my background as an internationally educated nurse. So I want to do more. Even while in Nigeria, I was involved in medical missions. I had my first trip to Philippines, and I was licensed as a Philippine registered nurse to do medical mission, to work in the operating room. And this is one of my Filipino friends, but we met here in the US. And so my whole vision is to do perioperative nursing care within my country and outside my country. And that is the vision for the United States. I love surgery and music. I want to tell you that I love every operating room where we are doing surgery and then we have a kind of music going at the background. And it's giving me that joy. And I'm hyperactive when I do that. That's for me. It may be different from you, but just to let you know things that I like. So this picture was taken in Nigeria. It was the very first minimally invasive spine surgery that we did in Nigeria. And I scrubbed for that case with Professor Wale Sulaiman. So talking about robotic surgery versus laparoscopic surgery. Let me give you a little background about the surgical evolution. Traditionally, surgical services started with maybe open minor cases and things like that. And at some point, it advanced into laparoscopic surgery. I'm not here to give you a lecture because I do not know people's background here on surgery. But all I know is that as a perioperative nurse, there are three integral domain for perioperative nursing practice. The first one is pre-operative patient care, and the second one is intraoperative patient care, and the third one is post-operative patient care. But today I'll just be telling you something about, robotic surgery and the laparoscopic surgery. And this is in line with the cultural shift within the surgical services, globally. So the culture, is shifting from traditional open surgery to laparoscopic surgery, and now we are now going to robotic assisted surgery. So for those people that have preoperative nursing background and they're thinking of maybe you'll be interviewed to work in the OR, most of the facilities in the US, I want to say, I don't have the facts about it, but you can fact check this. Uh, Most of the operating rooms in the US would want to have robotic services in their unit. I don't want to say that all of them have it, but most of them would want to have robotic services within their service care. So it is important for you to prepare your mind for your mind to learning new things, and then for you to be able to adapt into the operating room. And it also depends on the specialties that you are going to be working when you come to the US. So I cannot speak for every facilities here in the US, how they do their international nurses orientation. But from my experience as a preceptor, where I work with some international nurses as a preceptor, as a manager, as RN circulator, as a first assist. I'm going to share my experience with you. So I may not be able to speak for every facility. So that's what I'm trying to say. So before talking about the benefit of robotic surgery over laparoscopic surgery, I want to share with you that the operating room here in the US uh, is a little bit different from the operating room where we are coming from. For example, for us from Nigeria. So in terms of equipment, here you have a lot of advanced surgical equipment that it is expected of you as RN circulator to know how to do at least basic troubleshooting of this equipment. I think I'll just give you the good stuff about the operating room. Then I'll now tell you about the downside of it, what you should expect in terms of some possible challenges that you might face. But as registered nurses, I think when you talk about even for you to adapt into the US, it's important for you to know that clinical practice is guided by, evidence-based practice, you know, evidence-based practice, protocols, and the multidisciplinary collaboration. So you need to prepare your mind for that you are coming to a place that is different in terms of environment, in terms of equipment placement, in terms of surgeons, and in terms of people with different backgrounds. And that's what I said, multidisciplinary collaboration. So if you prepare your mind for that, and if you can work effectively as a scrub nurse in, for example, where you are coming from, and you can work as a circulating nurse where you are coming from with limited resources, I think you are going to be one of the best nurses in the USOR. I'm very sure of that. If you can survive where you are as preoperative nurses or as any nurse coming from a country, a low-income country with limited resources, if you get to the US, if you are still passionate about the job you are doing, about nursing, you are going to be one of the best nurses. Already you are trailblazers, and I congratulate you, like I said. Some people are just dreaming to even register to start their NCLEX journey. But you are more than that. You are trailblazers. Congratulations. You are far away from where other people are just beginning to start from. So robotic surgery is advanced in terms of equipment, in terms of the technology, in terms of it's technology driven, and at the same time, there are about 5 specific benefits of robotic surgery over laparoscopic surgery. I want to believe that I'm not confusing you, because I talked about the traditional open surgery, which is becoming more kind of obsolete now. The traditional open surgery that we know where we are coming from, If you need to do appendectomy, we have to open the patient. We need to do a cholecystectomy, that's taking out the patient gallbladder. You have to open the patient up. Big incision. Patient spends several days in the hospitals. Patient does not even have money to buy antibiotics. Patient might even come down with infection because of our operating room environmental parameters that does not meet the AORN or the recommended standards. So, but if we can survive and our patient can even survive with those limited resources, what I'm trying to say here to you today is that don't be scared. Don't be afraid of working in the US operating room. Rather, see it as an opportunity for you to leverage things that you've learned before to build for more opportunities to advance your career within the preoperative nursing ecosystem or practice. All right. So, but this is what me to talk about robotic and laparoscopic surgery. So when we move from open surgery to laparoscopy surgery, you know, people's the laparoscopic surgery became things of the time. Everybody talk about it, and it involves the use of what? Small incision into the patient, and then with use of what? An instrument called laparoscope or telescope to visualize body cavity, and they perform surgery with some instrument, you know, laparoscopic hand instrument, so that the patient can go home that same day or few days. And the picture to my right here is one of my pictures I took when I was a rep for Olympus. I was the clinical application specialist for Olympus. I took this picture when I was at Yenugua. That was in the Delta State. So that picture, I was giving a lecture about this equipment to people. He was talking about upper GI endoscopy. So, but now we're talking about robotic surgery. This is one of the recent pictures I took with when my facility just got this new machine. It's called GV5 robotic platform. It's different from Da Vinci robotic platform. So technology is going, you know, innovation every day. People they are not sleeping. Scientists are not sleeping. Innovators are not sleeping. They are trying to invent new things every day. And that is why we nurses supposed to what? Continue to change without what? Changing environment. And that is what is going to happen to you by the time you cross from wherever you are right now into the United States. Perhaps some of you are joining from UAE, joining from Saudi Arabia, joining from other countries that are from UK. Perhaps a lot of nurses are coming from UK. They are transitioning from the UK to the US now. Some of them have had opportunity of working where they have robots. Okay, so it depends on wherever you are joining from. But as of today, we're talking about the benefit of robotic surgery over laparoscopic surgery. What are the benefits? The first one is ergonomic advantage for surgeon. People ask me most time when I try to precept or teach students, the nursing students in the OR, or when I have some new nurses coming in or new grads, how much does it cost for patients to do this robotic surgery? I do not know specifically, but all I know is that for a patient to do robotic surgery, the patient needs to pay like something like $20,000 extra for you to have your surgery done using robotic assisted machine, you know, compared to laparoscopic surgery. But if you ask me personally, my personal opinion about the benefits of robotic surgery over laparoscopic surgery, I would say it is what? It is relative to the patient because I'm not in their position. But it is more beneficial to the surgeon, for me as I know. But it doesn't cause any harm to the patient, but it's more beneficial to the surgeon. Why? Because surgeon doesn't need to scrub in and struggle with instrument and things like that. Surgeon needs to sit somewhere, sit where you have the console. You know, that is the surgeon console to the left. Yeah, and the surgeon can do the surgery while robotic arms, you know, is performing the work of the surgeon. All right. And that is one thing that in terms of ergonomics, then it helps surgeons to, I mean, in terms of their own health, health-wise. And at the same time, for scrub nurses I'm a scrub tech, in case you have scrub techs in your unit if it comes to the US, or if you are using nurses as scrubs. And then the assistant can also have the time to sit down and relax when there is no need for instrumentation. All right. So that's the economics aspect of it for the what? For the team, for the surgical team. The benefit, one of the benefits for the patient is that reduce patient trauma because the incision is very small. So patient is less traumatized in terms of the amount of skin incision that you are going to make. And you know, when you cut the patient's skin, we have some pain nerve endings that are there. So the larger the incision, the more the pain the patient is going to have. So that's the benefit for the patient. And another benefit for both the surgeon and the patient is the superior precision and dexterity. So what do I mean by precision? It's a precision surgery because the robotic arms give the surgeon the opportunity to go to different, most difficult crevices within the patient cavity. And with that, robotic instrument can get to anywhere within the abdominal cavity, pelvic cavity, whatever. It will get there, but as compared to laparoscopic surgery, when you have the instrument that is not that flexible, but the instrument is so rigid, straight and rigid, not flexible, to be able to do some fine, dissections and the precision cutting of patient tissue, so that the patient will not come down with any mishaps in terms of adverse maybe effect of patient having the surgery. So it allows for superior precision robotic surgery because it's a technological uh, machine that has it takes like the surgeon, So the surgeon is there, but it's not that it's the robotic machine is the one doing the surgery, but surgeon is the one controlling the arms. But the arms, the surgeon can feel the arms can feel the surgeon. That's the way I'm talking about dexterity now. So it allows for precision surgery. So if you have the time, you guys can look it up, and for you to have more information about it. Another thing is enhanced visualization. When we started laparoscopic surgery, especially in Nigeria, GNCI, pioneered most of the Olympus medical equipment installation in Nigeria. And then we started with the standard definition monitor. That monitor you see there, it's called a medical grade monitor. And it was a standard medical grade monitor by Sonic. That was Olympus were using at some point. And after that, we advanced to one called 3D imaging. So in 3D images, that's where you use your glasses, and the surgeons use the glasses when they are doing the surgery. And one of the reasons why they advance into 3D images is because the 3D images in surgery, it gives the best depth perception of what the surgeon needed to see. And the colors separate the nerves, the blood, the arteries, the veins. You can see everything clearly. So if you want to cut the artery, you know that this is the artery you are cutting and not the vein, not the nerve. You understand what I mean? So that's one of the advantages of that 3D. It gives you the depth perception, especially when you're doing the laparoscopic surgery. Then after that, the technology advanced again to 4K monitors. So people we are tired of wearing glasses. It's not giving us, I'm not comfortable wearing glasses, things like that. So they moved to 4K, imaging technology. And with 4K, you don't need glasses, and you're able to see everything you need to see. Because the idea behind laparoscopic surgery or minimally invasive surgery or endoscopy procedure is for the surgeon and perhaps you, the team, to see what you need to see so that you can help the patient and provide what we call prompt diagnosis and a plan for what effective treatment of your patient. So prompt and accurate. I need to emphasize on that. It must be prompt and it must be accurate. And that is one of the reasons why those people that are the inventors are working hard to make sure that they come up with new technologies that will help our patient within our preoperative practice. All right. But now they give back to what? To robotic assisted surgery. That's just a flashback, just to emphasize more on on that. So enhanced visualization is all about, standard definition monitors, 3D monitors, 4K, medical imaging, and now we have a robotic surgery. So robotic assisted surgery is very expensive for patients. We need to know that. And when you come to the US and you happen to work as a circulator, so you need to put yourself together to ensure that you minimize waste. Because every facility wants to ensure, or they apply what they call the lean management principle to their operating room. And we need that in Africa. We need that in wherever we are working to make sure that we minimize what waste within our practice. And it's going to help our facility, it's going to help our patient too. If you waste instrument, if you waste anything here in the US, you are not going to be paralyzed. Not waste, sorry. I don't want to use the word waste because you are not meant to waste. So if it happens that mistakenly or accidentally you drop sterile something that costs $20,000, nobody's going to kill you for it. All right. So in as much that you are doing it for the purpose of patient safety and infection prevention and control, you call for another one and they get it. And don't let us forget our surgical consciousness. We learn that even wherever you go, every person working in the operating room must what? Have what? Surgical conscience. Surgical conscience is that thing that tells you that you need to do the right thing, even when nobody is watching you, right? So we need to do that. So yeah, if anything drops, if they waste a lot of things here, my first experience in the US 2017, they just change gowns, throw everywhere, like, come on, gowns, like changing everything, tear down drapes, tear down. If they seen anything like any small, maybe a cardboard in a patient park, that patient park will tear it down. Because here in the US, nobody jokes with infection. Surgical site infection is a big issue. If patients should have surgical site infection in your facility, and then maybe for certain percentage of time, your facility may lose their Medicare and then some of this accreditation to even do surgery. So infection prevention and control is very, very critical or crucial to save surgery anywhere in the world. It's not only in the US, even wherever you are working, wherever you do surgery, when you have limited resources, infection prevention and control should be one of your priority for what? For safe surgery, for optimal patient care and safe surgery outcomes. I think I've said a lot about robotic surgery and laparoscopy surgery. Let's talk about things that may interest some of other people that are not working in the operating room that might be joining us today. Transitioning to the United States is not merely a change in your address. It's not just that you are moving from Saudi Arabia to the US, or you are moving from Nigeria to the US, or you are moving from the UK to the US, or from the Philippines to the US. It is a transformation of culture. Your mindset need to change. I'm sorry, I'm so passionate about telling you this. You need to change your mindset because it's not going to be the same thing. Because every day you keep learning. And when you move from one state, especially if it happens that you need to work as a traveler, from one state to the other, you need to reorientate yourself, learn about their culture, change your mindset to be able to fit into their own system. So, and the transformation of system, the system is different from Nigeria. So let me start first with the culture. Culture here in the US generally is that a nurse working in the operating room will work as a circulator, not as a scrub nurse. That was, let's say that is the general or the basic requirement of RN in the OR is to work what? Is to work as RN circulators, not to scrub. Because I know some people would have been thinking like, oh, when I get there, I'll be scrubbing, I'll be doing that. I'm not saying you are not going to scrub. I'm just saying the basic, the general, something that cut across almost all hospitals, RN circulators. All right. But because of the shortage of staff, so most of some hospitals, don't let me say most because I do not have the figures, because America is so big that you cannot really say this is what is happening in that hospital. I don't know what is happening in Decency's hospital if Decency is still working there. I can't see, but I can only speak for where I've worked. And from my experience as traveler, I've been to different hospitals. All right. And I can benchmark their practice to share with you. So the second thing, the second level is either you scrub and circulate if they don't have enough scrub tape. Some facilities may what? Allow you to scrub and then what? And circulate. And as a matter of fact, because of that shortage, America needs you. The American system needs a lot of nurses. I'm telling you, you coming to the US is not a burden on the system. But to some people might see it as a burden. But when you explain to them, I'm talking about the people here, the people here. Because when you come to this place, the first time the question they want to ask you most of the time, even when you meet somebody outside, they ask you, where are you from? Because the way, are you from here? Like, you are not from here. You know, where are you from? Right? Even your accent and some other things. We still talk about that. But in terms of practice now, I'm trying to talk about cultural adaptation with respect to practice. So you might not work as what? Scrub, but as a circulator. And thank God that by your training as perioperative nurses, either in Ghana, in Nigeria, I don't know, for some other countries where you might be joining from, a perioperative nurse in Nigeria must be able to scrub and also to circulate, and also to work in PACU, and also to work in pre-op area. So that's why I said that it is a great advantage for you when you move to the United States, where every patient care is well defined. Your responsibility is defined. You are not a jack of all trades. You understand what I mean? You are not a jack of all trades that you have to circulate, do this, do that. If you're a circulator, you're a circulator. If you want to scrub, you are a scrub. If you are a packing nurse, you are a packing nurse. Nobody asks you to finish scrubbing and go and recover patient. No way. So, and that is where we're supposed to tend to. The African perioperative nursing practice need to begin to change. All right. So, and that's an advantage. I'm giving you the good stuff about the cultural adaptation here in the US now, because your responsibilities, your role is what? Is specific to a particular area of care. Do you get me? So your responsibility, your role is specific to what? A particular area of care. And another good stuff about US practice is the fact that when you come to the US, nobody's just going to put you in the room and say, go ahead and work with the patient. No, it is a good culture of safety in the United States, whereby you are allowed to be trained. You can never be by yourself alone. Some facility can train you for 1 year. Some can train you for 6 weeks. Some can train you for 6 months, depending on specialties they put you. Maybe you want to do cardiovascular, and you are just cardiovascular, you are on cardiovascular team. That may require maybe extra more months for you to be trained on cardiovascular team before they can leave you to even be on your own, right? So coming from Nigeria, and the fact I had that opportunity of learning from them before I eventually relocated to this place, it was a little bit easier for me. But for my wife had never been to the US before, but I was able to inform my wife about some cultural shifts, some cultural changes when we eventually moved to the US. Because my wife is also a nurse and she works in the OR. And when she got to the OR, and through an agency, my wife was trained again, all over again. So, and that our mindset, we need to change our mindset to say that this is how we do it, where we are coming from. No, this is a new place. This is a new system. So you need to what? Learn how to adapt to the new system. Learn how to do it the way they are doing it. Okay. This actually made mention of the fact that I am part of AORN, and thank AORN for a lot of opportunities AORN have given me. I spoke at the AORN conference this year. I was featured in there as a featured speaker, and I chaired I co-chair the e-chapter of the AORN. But AORN have standard of practice and guidelines for preoperative nursing practice that is expected of every places where surgery is being done, either in the operating room or ambulatory surgery centers, there are guidelines that we're supposed to follow for every aspect of our patient care. For us to provide that optimal patient care that is safe at all times. But AORN cannot force any hospitals to follow that, to follow the guidelines. So, but JCO, JCI, those are the ones that will put pressure on the hospital. AORN can only make recommendation, they can't force. I'm telling you this because you might say that this is the best standard of practice. You may get to a facility in the US and you see them, they are not even using electronic medical record. And you're like, but this is America. I thought they are using electronic medical record. Not all hospitals use electronic medical records in the US. So you're right. But when you come to the US, but let me say 95% of hospitals in the US, they use electronic medical records. You chart, you need to learn all those systems. When you can visit some hospital, they still do paper chart, right? So it is system is how will I put it now? I'm looking for the word to use now. There is no perfect system, okay? Anywhere in the world, there is no perfect system. But the best thing as we nurses, and I think I can't remember this a nurse scientist that talks about the adaptation theory. If anybody can remind me of adaptation theory, he said man is a psychosocial adaptive being. That is what? That is constantly changing with his what? Changing environment. So I want you to see yourself, because you are a man, you are a human, and you are what? You are a psychosocial adaptive being. So you can change with the environment. Don't be rigid to change, all right? Don't be rigid to change. And don't don't argue, don't, because the system will test you, all right? I want you to know that this US system is going to test you. It's going to test your knowledge. It's going to test your competency, all right? And by the time you are by yourself and nobody is there with you, you are expected to practice at your optimal what? At your optimal skill, all right? At your optimal skill. Even though it is not only about skills, right? It is about what? Your mindset and things that you need to know. So the American healthcare environment is multicultural, is merit-driven, and time-conscious. So you need to respect everyone. Punctualities, they don't joke. We have to badge it, clock in, clock out. Something came to my mind now about another culture that I want to share with you. I'll just be, because I'm sharing my experience, I'm not to give lecture. I want you to understand, don't expect too much from people here because they don't care. All right? It's not that they don't care about you, but they don't care about your problem. They don't care about your story. I'll share this experience with you. One time my wife was sick and I needed to call the OR because I was off duty. We work in the same hospital. And I called the OR like, hey, I was calling my charge. Hey, I just want to tell you that my wife is sick. She has this, she has that, she has that. He said, Johnson, okay, there's no problem. Bye-bye. How will you feel?
You
How will you
wanted at
feel?
least, sorry, what's going on?
Yeah, I wanted like to just
I
show a
would,
little bit of compassion. Like,
exactly.
okay, compassion and things like that. They don't care.
No one cares about you. That's your problem.
And it is not to offend you.
Yeah.
So I want you to get it. It is not to offend you. It is not to hurt you, but it's the culture. So you can see somebody that you greet someone and the person never said hello to you. Don't be mad at that person. The next time, don't bother to greet anybody because nobody cares about you greeting them. All right? Nobody cares whether you greet or not. But one of the cultures that the hospitals are now trying to emphasize upon is about that culture of respect for patients, for people. Sometimes when you work in the facility, they have different things. You're expected to put a smile, maybe when you have like a 5-step distance from somebody approaching you,
Smile.
you're expected to put a smiling face, even though it is fake.
Fake smile.
Just put that, even if it's a fake smile, you have to
Fake
put that
smile.
smiley face. Even if it's this person that you don't like or that talk to you anyhow, when you are walking, just put a smiley face. You don't need to greet. But if this patient or visitors, because they want all their patients to feel at home, which is normal. All right. But when it comes to professional relationship, don't do outside your professional relationship. Otherwise, somebody is going to hurt you, or you might hurt somebody. Because here, people are super emotional. People are super emotional. And the fact that we speak loud, even when I'm talking to somebody, there was a time I told, this is not even, I told one of my preceptee, I just tried to explain something to her, that I told her that she should not focus on learning about electronic medical chart on the system, that she should focus on the operating room, the work itself, that she can always learn about that because she's still under orientation. Nobody's expecting her to chat on the system. But because I always allow my students or my preceptors to chat, use my chat to learn ahead of time, so they're always ahead of their mate. And she went somewhere and she started crying. And people started coming to me, especially my great Filipino friends. They're like, brother, what did you do to this person? I said, what did I do to whom? The person is crying now. She's crying. I'm like, oh my God. I didn't do anything. He said that my voice was loud or not. I'm like, that's the way I talk. You know, an African we speak loud, right?
Yes.
So this is one of the things that we need to talk and look at that. So if you need to reduce your voice sometimes when you are working with them, you can reduce it. For me, I did not change the way I speak since I got to this country. All right. But I try to educate to make sure that they hear what I'm saying. But I do not form accent. If you can learn the American accent, good for you. It will help you if you become nurse practitioner, if you want to advance your career, to be seeing patient and things like that. It will not be nice for patient not to hear you. And for them here too, they have accent. They don't hear one another. So if you have somebody coming from the South America, coming to the northern part where we are now, and is a struck tech talking to surgeon, they'll be asking themselves, what do you mean by that? And that is when I will tell them that, okay, now you say, Johnson, you have strong Nigerian accent. I say, you too, you have an accent. So, because, yeah, they speak differently. Now, somebody coming from New York, the way they speak in New York is different from the way they speak here in North Dakota.
That's true.
All right. So the different way they talk, different way. So the same thing. So we need to what? In terms of relationship, I'm talking about culture now, we need to just try to adapt. It's not something that you're going to get into in just one day. You keep learning, you keep learning. Even when you move from one place to the other, they have different culture. In terms, the culture may differ. At least they have something different about the other states you are coming from. So the Midwest, where we are right now, I think they are similar in terms of culture and some other things. But if you go to South or East, the East, West Coast, different things. So you need to, it depends wherever you are going. But anywhere you find yourself, I want to say that anywhere you find yourself, excuse me, I have code. Anywhere you find yourself, try to adapt to that particular place and build upon that, the culture of that place before you begin to what? Move around.
Good.
Right? Learn from the system. Okay, I'm rounding up quickly. So because another thing is that open communications are core values here in the United States. You need to what? Meet patients with different ethnicities, religions, sexual orientation, backgrounds. We need to be very careful because of our own background when it comes to sexual orientation. I'll tell you this, my first time in the US, I work with a nurse, my very good friend. We are very good friend now. See now. And each time he does something good for me or something nice, help me to do something, I'll say, thank you, man. I want to like America. The first time in America, I say, thanks, man. Thanks, man. Thanks, man. Thanks, man. Thank you, man. Thank you, man. So one day the guy just said, Johnson, are you on Facebook? I said, yes. He said, try and join me, be my friend on Facebook. Because he could not tell me that, he could not tell me directly his sexual orientation and I should stop calling him a man. All right. He doesn't want to disrespect me. He doesn't want me to feel bad. He understood the fact that I do not know. But he's looking for a way to show me how to get to know him more. But he cannot tell me directly so that I would not feel hurt or feel like, oh my God, I've done something wrong. So when I went to Facebook and sent a friend, then I get to know about his sexual orientation. That does not mean that I'll not, because of that, that it's no longer my friend. We are still friends. But because of that, I know the sexual orientation, then I adjusted the way I talk to him. All right. So I just mentioned that in terms of open communication, things that you may see, so know that you will not go outside your band, your boundary. All right. So it is important for us to provide care that is deserving and that is compassionate, and don't forget our patient, they deserve that respect for dignity. It's very important for our patient, even for ourselves now, even colleagues, we need to respect one another, and you need to embrace diversity. And if you embrace diversity, and I'm very sure you will try. You have people, Filipinos, Mexicans, things like that. We work together in the OR. We try to learn about some of our culture. Like last place I worked, they were the first time they were almost, how will I put it now? I don't want to say like attacking me, like you people are coming to take our job and things like that. But I didn't get upset. But what I did eventually was to teach them, to orientate them that I'm not a burden to you. In fact, I'm working. I'm not a burden here to you. Because they do not believe that we did any exam before coming to the US. They thought whether we just came through the border. And let me, to surprise you, I wanted to put the picture, but I didn't have time to put that on the slide. Do you know when we have this conversation at the range when we were shooting guns? I was the only black there. And that was when they were telling me. They would have, if they are bad, they just keep me, nobody would know where I was, but I always told my wife where I was going. I was at the range. I was at the range. I was learning, we're shooting guns, like aiming things like that. And then we have that, you guys are coming to take our job. And I'm like, which one is your job? I'm not a burden to you. I came here legally. So you guys, you have done a great thing by passing your NCLEX. And I'm telling you, your visa will come. By the grace of God, your visa will come. Right? So when the people try to attack you, not that like, they will attack you. That's why I'm saying that the system is going to test you. The system will test you. They will test your practice, your competency level. They will test your cultural know-how. They will test your level of, maybe respect in terms of who you are as a person. So it is left for you to be prepared, so that you will not overreact. All right. And this is the country when people overreact, everything becomes escalated. The next thing, the next person bring out, go out and
shoot.
So let me share this experience too. Because I mentioned about gun now. Recently I was in the one facility maybe 2 months ago, and the pre-op charge nurse received a phone call. The person even thought it was the patient that was calling to book an appointment for surgery. The next thing, the lady here was like, I'm going to find you, I'm going to kill you. And because of that, everywhere, they lock everywhere because they thought somebody might come to the hospital with the gun. I'm not saying this to scare you. There are very security measures in place. And during your orientation, they will teach you everything you need to know to be safe in every facility. One good thing about the United States is that everything is on paper. They train you. So you are going to be trained for every aspect related to your patient care, every aspect related to you as a person, because it is their responsibility to protect you and to protect your family. So it is not a place. And when somebody said he was afraid of raising children in the US, yeah, the person may be right or wrong. But if you are not here, you will not see how it is until you are here. You can find yourself in a particular state, and this thing, you can Google it. Best places to raise children in the US. There are many best places to raise. You can start your first contract, your assignment with your agency, recruitment agency in a particular city. You can bring your family there. And when you're done with your contract, after you completed your whole contract with your agency, you can decide to move to anywhere. That's why America is good. You can get your multi-state license and move around. When we first came to the year, we came to Texas. Now we find ourselves in North Dakota. Then we call North Dakota our home now. This is where we are. This is where we live. And we were intentional
Coming to
about coming.
Virginia.
Yeah, I know you go. I got you be saying it too. Yeah, I got you be saying that Virginia. Virginia is a very lovely place. Most of Nigerians are there. Most of, I mean, our people, different people are there.
But
Yeah.
Dr. Johnson, we want to have you here too. You'll be a great addition.
Yes, and one good thing people should know about America is that even when you have a house, you build your house, you can move to another state, you sell your house, and you
Yeah.
buy another house. And Decency is there to get you a house anytime you want to. All right.
Someone is
So,
protesting in the comment section. They say you're coming back to Texas.
okay. All right. Texas is, and that's why I was talking about weather. I love Texas. Another thing that you need to understand about about the US that I love Texas. I always like to go to Texas because of the warmness. The humidity there is very high though. But like if you are the one that work in the OR that like cold, like in Nigeria, you get to OR maybe by 6:30 in the morning, you leave your house 4 a.m. and you leave the theater maybe 6 p.m. or you be in traffic till 10 p.m. There was no sun to you and things like that. When you get to this place, you may not want to go into Texas because of the heat. Well, it depends anyway. It depends on you. But my wife, she loves cold. She loves cold. And that's why. So, and Virginia is very perfect. My first time in Virginia, I saw trees. I was so happy. Yeah, in North Dakota, we don't have trees. The only thing you see is the snow and the cloud. They match together. When you are driving on the snow, it's like you are entering to the heaven, because everywhere the snow and the ground, they match together. All
You're
right.
already here, man. You're already here.
Yeah, right here. So, so that's that about the system. Let me just go back a little bit one more time because it's important that we emphasize a lot about cultural adaptation. And I want to reiterate the fact that this place is not a scary place to work. Like I've said, you have survived limited resources environments. This place gives you opportunity to grow, to learn new things, to unlearn what you've learned in Nigeria, to learn new things again, and for you to what? To advance your career. It gives you numerous opportunities for you to diversify and for you to be where you want to be. If you come to the US, you don't want to study nursing again. I'm just saying you can decide to do it. You can study medicine, all right? So yeah, I tried it. People put pressure on me. You need to go back to medical school. I did. I got admission there, but I didn't go. I have my admission letter. Well, you see, I'm just testing the system. The system is going to test you. But if you want to survive in this country, you need to test the system. You need to challenge yourself. You need to be part of the things. You need to join an association. You need to be not to overdo things. It is important. No, don't overdo things because nobody cares about if you overdo anything. Nobody cares about it. I'm telling you. Nobody's looking for a nice guy. Nobody's looking for a nice guy anyway. They just want you to do your job. Just go home. They pay you. They won't owe you. Do your job diligently. And I want to tell you, my brothers and sisters, that when you are leaving your house for the operating room, everything about happening in your house, don't take it to the operating room. Don't take it to your workplace because it might influence your performance that day. And I'm telling you that some facilities recognize, hard work, and they can, with there, you can begin to develop your own leadership career through that. All right. But do not bring your problems to the OR because the OR itself, there are a lot, it requires a lot of attention in terms of you need to multitask in terms of circulating. You have to get this, you need to get that, you need to get this, you know. And the equipment wise, you need to learn about all their equipment. And one thing is that they will train you on those equipment before you start using them. If you find yourself in a facility when they have an equipment that you have not been trained upon, request with all humility that you want to learn about the equipment. Excuse me. You want to learn about the equipment. So they're going to teach you about those equipment because if you do not know your environment, when you work with surgeons, it's going to be a little bit challenging for you. I don't want to say problem, because I see every challenge as an opportunity for me to learn a new thing. All right. And what with surgeons here, like what we do in Africa too, sometimes we have some surgeons that are difficult. And that is why we did psychology as nurses, we did mental health nurses as, excuse me, as nurses. I'm losing my, as nurses, and you'll be able to manage people, right? And don't forget, perioperative nursing practice in Nigeria, the training we went for school is perioperative nursing and OR management. So you should be able to manage everybody in the OR. Let me give you my own trick. What I've been using since I was in Nigeria is that whenever I'm working in the operating room, in that room, I see myself as the landlord of that operating room, or not the landlord, or I can say the host. And people coming to the operating room, they are my guests. Then if you are hosting somebody in your house, are you going to be hosted to your guest? No. You have to what? You have to be nice to your guest. So I'm not saying nice to them and be kneeling down or saying yes sir, yes sir, yes ma'am. They don't even care about yes sir, yes ma'am. I need to tell you that. But you
Yes.
need to make sure, yeah, but you need to make sure that everything you need. When I was in Nigeria, why to the glory of God, I was able to distinguish myself. It's not about me, excuse me, assessing myself. It is about the people, what people says, people have said about me. What I used to do is to make sure that when I work with any difficult surgeon, you are going to be my friend, because I won't give you the opportunity to abuse me, because I will look for everything you like. When I was working at teaching hospital, I have my own Makindo scissors, extra Makindo scissors that I used to microwave. If it comes to surgery, say this Makindo scissor is not working, I'll go and bring it. You don't need to do that here in the US. I don't need to do that in Nigeria. I'm not doing that because I want this surgeon to like me, but I don't want any problem. I don't want to have a deal with anybody, right? So I'll just use that as an example. But here, if you know that you have preference card for every surgeon, go through your preference card, know what the surgeon wants, all right? Anticipate what they could need. And most importantly, you need to respect your scrub techs. I'm not saying respect them by saying good body, sir, good body, man. Respect their intellectual prowess.
Mm-hmm.
Because these are the guys that have been working with all these surgeons all this year. They know their do's and don'ts. And if you are friend with scrub techs, when you are walking into any operating room and working with the surgeon for the first time, the scrub tech will tell you like, this is the item that this surgeon likes. He likes to put his pedal, maybe a drip pedal on the left, not on the right. If it is not stated in the preference card. But however, everything about surgeon will be what? Highlighted. You know, everything will be well explained in the surgeon preference card. Because nobody wants to have a bad day. Everyone wants to have a good day. All right. So I asked the scrub tech, even when I know what I need to know, I know everything I need to get, but I'll still ask them, is there anything different that this surgeon might want aside from what I've prepared? The scrub tech say, okay, it's fine, everything, you got everything good, excellent. Also they say, okay, I think, because they will never tell you anything straight because they don't want you to quote them. Another cultural thing you need to understand, nobody will tell you, say, go ahead and get this. But they will use the word that I may, like they will, in second, like third party, like I may want to get this. So you need to go and get it. That's what they are trying to tell you. So you need to get everything ready for your operating room. And don't forget, as perioperative nurses now, for those that are going to work in the operating room, there are three things that are very, very important for you to have a good ADOR. The first one is environmental preparation, starting with the operating room table. With your operating room, everything you need to do, make sure you do everything. Patient safety first, starting with operating table positioning. Have the right operating table in the room. Have the right bed accessory in the room. Have everything that requires safe surgery in the room, because safety always comes first. All right. And the second thing you need to do is what we call personnel preparation. I first mentioned about environmental preparation, which means getting your room ready, getting operating table ready, accessory ready, equipment ready. The next thing you need to get is personnel preparation. Who are the personnel? Yourself, your surgeon, your scrub tech. You need to think ahead of time. What would they need? What would my surgeon need? If it is a facility where a surgeon needs to have headlights, you need to make sure you bring the headlights into the room. If it's a facility where the both the scrub that we are doing orthopedics, they need to wear maybe anything the hood, you know, just for safe surgery. You need to get everything in the room. You need to get the gloves and gowns for surgery in the room, depending on your facility policy. Please don't quote me. Like I said, always follow your facility policies because they have policy, they do things differently, but it might be the same in most hospitals. In some hospitals, when they pick the patient card, you have surgeon gown in the patient card. Patient card is the item in the container, everything you need for surgery, all your consumables, including gowns, gloves, and other consumable items that you need to open. So they can have everything ready, all right? But in some hospitals, they will put it there like, RN circulator need to get the surgeon's gloves and gown. It's not that the scrub tech cannot get it, but specifically where I work right now, it will be written there that RN, it is your job to get the surgeon, RN circulator. It is your job to get the surgeon gown and gloves. Don't forget to get the surgeon gowns and gloves. Don't let the surgeon come to the room already scrub and ready to gown, and the scrub tech will be looking at you. If you have the bad one, because not everybody is good, I must be sincere with you. You have to manage everyone and make sure that you have a good day on your own. You need to be happy for yourself because it's not going to be a good day all times. Please note that. There could be some day that the surgeon will be the one to throw tantrum, but it is your ability as the host of that operating room to make sure that you calm everything down. You need to be calm. You need to calm down yourself for you to be able to listen. And you need to listen to, so that when you respond, you will not respond in a harsh way that will make you to lose your job. I'm telling you, it is easy for them to fire anybody here. It is easy for you to fire them. You understand what I mean? Because every contract doesn't say, the contract will not say that you are going to work for us give us 1 month notice before you go. That's when by that you complete your contract anyway for your contract. But your contract will be different. Of course, you guys sign a contract with your agency. I'm not going to that. But as per facility, when they hire you, and on your employment letter, you can start tomorrow and they say you are going tomorrow. They won't even tell you the reason why they ask you to leave. It's not to scare you, but and of course, there are bad nurses, there are good nurses. There are good doctors, there are bad doctors. There are good patients, there are bad patients. All right? I did a surgery for a patient 2 days ago. The sheriff needs to come to the room with the patient because they said this patient had a history of assault to staff. You see, this patient was there. When I saw the patient myself, I knew that, oh, I can't handle this patient by myself. Thank God for police that came with the handcuff and everything. So, not to scare you, but we are telling you that you need to continue to adapt to that changing environment. But make sure that you do not compromise what? The standard of care. There are places where they say this is where they do things, but respectively, I'll tell them that you are doing it wrong way. This is not, okay, I'll bring the AORN. I work in a facility where they were doing things wrongly, and I told them that this is not according to the best global practice. And then the person I work with in the room didn't feel good. And one day I told this supervisor, like, okay, can we have can we have like a webinar, or can we have like during Huddle, can we talk about this particular issue and reference AORN standard of practice? If you don't mind, I can send you some of the AORN guidelines that says this is how this things be done. And the person said, okay, yeah, send it to me, respectively. And when I sent it, the next departmental meeting, I did not take the lecture. I gave the person, I prepared the slide, sent to the person. She was the one that gave the lecture. Can you see that? There's a way, respectively, not that you are trying to show yourself, but you are trying to make a change within your environment. You are trying to make a change for what? For patient safety, for safe outcomes, not because you want to prove that you know it all, because you can't know everything. And like I said, the system is going to test you because of some of your colleagues' nurses here. will look at you as if you don't know anything. And don't be upset. Just step back and let them do everything and watch them. Your time is coming when you'll be the owner of that room. That will be you'll be by yourself. And you can do it your own way. Just make sure that you follow the policies and procedures or standard of practice or guidelines that you have in your facility. So the hospitals, they have policy and procedure for every situations. So you should be able to read everything, go through it. So if you are in doubt of anything, always refer to what? The policy and procedure. And the surgeon say, hey, I don't like this. I worked with one surgeon one day. I went to get a patient. And the surgeon and the patient was to have right ingredient adhere repair with mesh. And the consent said right ingredient adhere repair. Mesh was missing out of it. And as a perioperative nurse, I know that. And I asked my patient, before I even read the consent, I used to ask my patient, what are we doing for you today? What's the doctor also doing for you today? Or what are we doing for you? And patient told me like, okay, you guys will be fixing my right adhere. And because I had the left one done with mesh already, so I told my surgeon that you guys will fix it with mesh. And I look at the consent, and like the consent does not match with what my patient is telling me. Because the patient needs to have what? An informed consent. So I went back to, when I let the patient, I went to be the pre-op nurse. And I can't take this patient now because the patient said this, and the consent did not specify whether they are putting mesh or not. And the nurse said, I should call the surgeon because they are afraid of the surgeon. I said, I can't call the surgeon because the patient is still in your care. Could you please call the surgeon? I wasn't like arguing, like, could you please call the surgeon? Everybody, you try to play respectively. And eventually, she called the surgeon. And when she picked the phone, the surgeon picked the phone from the other side. The nurse told the surgeon that, hey, Johnson wants to speak with you. I was like, oh my God, you are supposed to wait. So I took the phone. I like, hey, doctor, so. I spoke with the patient. I asked the patient about what we are doing for the patient. The patient said you are doing with mesh, but your consent did not specify you are putting mesh. And the surgeon was mad at me, like, what do you mean? If you cannot get my patient, just tell me you cannot get my patient. This, that, and that, and that. Every surgery when you are doing repair and near repair, you must put mesh. You must put mesh. I'm like, really? But I've worked with you. I like, really, doc? I think I did one case with you. You didn't put mesh. And it was like, just to bring my patient. So I dropped the phone and I took the patient to the room. When I got to the room, I told the anesthesiologist that we can't put this patient to sleep until the surgeon comes to the room. So I paid the surgeon that, hey, doc, the patient is in the room now, and the patient would like to speak with you. It's between you and your patient, not me. When he opened the operating room door, he was like, hey, this guy, you don't want me to do this surgery. I said, doc, it's not about me, it's about you and your patient. Your patient requested to speak with you. So I'm not the one. Then I said, the patient said, doc, I think I told you that I want mesh here. And I said, yeah. And the nurse told me that it's not the consent. And the consent was just right there that I gave the consent. So the surgeon signed the consent. All right. So just to cut the story short, and then for that, we had to write incident report. That's something about America. If anything is not going well, you notice something, say something.
Mm-hmm.
If you notice something, say something. So you have to write incident report, not to indict the doctor or anything. So, and they will discuss it at the operating room governance meeting. And that never happened again. And going forward, they change the pattern they write their consent. So the surgeon used to write so surgery for you with all other indicated procedures, so that even outside whatever
Yeah,
they told you that they are going to do, if anything happens, they can do extra. Can you
mm-hmm.
see that change? So that's a change process. So what hospital America is looking for, they want you to be that change. Even when you come, irrespective of your background, your culture, how you speak, how you look, the most important thing to us is our patient. And you are the patient advocate. So it is important for us to continue to advocate for our patients because they are vulnerable. They cannot speak for themselves. And it is our own job to speak for them. So cultural competence is very, very important. Work balance is important for you to work and balance your activities to ensure that you live a good life in this country. Excuse me. I'm sorry.
Sorry about
For you
that.
to, thank you, I have a cold. I don't want to postpone this day.
Mm.
So it is important for you to balance work life in this country. Oh my goodness. When I got to this country, I saw my colleagues doing like 3, 4 jobs. People buy things, buy cars. I like, and I was okay in Nigeria. At least I was okay. We're okay. I work good. I was a manager. My wife worked in do some jobs in oil and gas, kind of PRA. We're good. We live well. We have good cars. But here, before coming to the US, I had lumbar degenerative disease for prolonged standing, scrubbing for neuro 14 hours in Nigeria. When I got to the US, I need to be careful. Otherwise, if you think you want to do like other people are doing, and you do not consider your health, what you are trying to, the money you can make in 5 years or in 10 years, that you still live a good life for 50 years, if you make that money within 1 year and you break down after 1 year and you live in pain for the rest of your life. So I need to choose. So the choice is yours. All right. So when you get to this place, there will be opportunities for you, because I tell people that, even my family back home, that everywhere you go, they say we are hiring. We are hiring. If you make a phone call now to what company, the first thing they will first tell you that if you like to join our facility or our company, we are doing this, we are doing that. They need people, right? But it's just that it's difficult to get to this place. But you guys are just like, you are like 99% ready to cross to this place. At that time we come. Because what I call success is when you are prepared. Preparation plus opportunity is what I call success. When opportunity comes and you are not prepared, that success will not be yours. But when that opportunity is here and you are you ready to go? And that's why when I was in Nigeria, they need anything, people would just call that guy Johnson. He will have the qualification for it. And because I try to always, I will train people about things that I know. I share my knowledge. But after training you, I will learn new things to make myself different from you. So when I learn that new things, I'll come back to teach you. When I'm teaching you, I will learn another thing to make myself different from you. So that, because this life is full of competition, all right? We are not to compete with one another, all right? But the life is full of competition. That's the way it is. It's survivor. You need to survive, right? So you need to, because most of the international nurses, they even though they are happy, the energy is there. Like you should be waiting. I know most of you have been calculating how much you would have made now in dollars. Oh my God. I would have made in dollars. But when you come to this place, I would say, please chase the money. Excuse me. Chase the money and don't chase the money. What do I mean by that? You are here, when you come to this place, you need to make money, you need to pay bills, you need to do a lot of things. You have so many that depends on you back home. You need to support them. All right. But don't chase money more than your life. Because the system gives you the opportunity. You keep working, working, working. You can work in this hospital, work in this hospital, because they need people. I'm telling you, they need people. But it's just that it's just so sad that the immigration system is so tough now. But in here, I know your guy Decency can say the truth, because they need people everywhere.
Everywhere.
Everywhere. They don't have people to work. Like I left the OR, Decency, I told you this morning, I left the OR 2:45 a.m. this morning.
Mm.
2:45 a.m. this morning. I was the last person to leave the OR. I was supposed to close 12:30 a.m. because I did 2 p.m. to 12:30, 2 p.m. in the afternoon to 12:30 a.m. the next day. That's my shift right now. I picked PRA. So somebody needs to get me out at exactly 12 a.m. Nobody came to my room. Scrub tech left me. Surgeon assistant left me. I was the only one remaining, because the nurse supposed to take over from me. It was somewhere that the person didn't show up. You understand what I mean?
Mm-hmm.
So they need so many people, and they need you. And that is why you have not made a mistake trying to embark on this journey. So when you come to this place, as you try to work to make money, create time for what? Pleasure. There are good places you need to go. And thanks for this NC. This NC has they have a lot of package for you guys, I'm telling you. It was, I think, was it not last year or two
Last
years?
years. Mm-hmm.
Yeah. So my wife and I, we were invited to DVM, nurses from Washington, D.C., Virginia, and Maryland. They gathered together. We had a blast for, I'm telling you, because it was fun. It was time to just go, forget about whatever that happens in America, forget about whatever that happens in Nigeria. We just want to think for ourselves and enjoy ourselves. So, right? So, create time for yourself. Think of things that will help you to relieve stress and while you work, because they don't joke. Americans too, they don't joke with their vacation,
Mm-hmm.
right? They don't
Mm.
joke with vacation. They don't have any family to like we African, we have money to give you. You have to
Black
listen.
tax.
Yeah. So they are all they save their money for vacation. Tomorrow they are in Mexico, right? All right. Okay. So and then this is if anybody calls they are when they want to travel to Mexico. My wife, she has one package that can give them discounted price. I
Wow.
participate.
Good. We'll be
So
reaching out.
my wife and I, we went to Mexico. We were at Mexico last year too. Just take your time out because America give you the opportunity. You work hard, you head well, all right? When I say head well, it may be relative too, because when you are coming in, some people you may feel bad like maybe your agency is giving you this so amount of money. I don't want you to feel bad. I want you to seize the opportunity, be focused about understanding the system. First, learn about the system. Get things that will make you self-reliant, that you, anywhere you go, people will not look at the way you talk or your skill. They will look at what you have in your brain. I'm telling you this is very important. But if you are, no, I'm not saying, so I'm talking with respect to your recruitment agency now,
Mm-hmm.
because some people might work in facility where they pay 20 something dollar, 30 something dollar. Some
Mm-hmm.
people might find themselves in another city where they are paying 60. Everything, American system, it balances itself out. If you live in New York, the house rent in New York is different from the house rent here where I live. So what I get here is different from what they will pay in New York. The nurses in New York, they get paid higher than what I heard here in North Dakota. Because cost of living in North Dakota, it cannot be compared to cost of living in New York. So don't compare yourself with people. That's what I'm trying to say. Don't compare yourself with your friends. First thing when you come in, be calm. Like my father used to say, that the more tranquil you are, the more serene you are, the greater is your power for success in life. And he will translate it in Yoruba in my language again for me to understand that word. So the more calm you are, all right, ability to learn, to pretend as if you are stupid. Not that you are stupid, though. Learn first, okay? But when it comes to patient safety, speak up. Please speak up when it comes to patient safety, because it will come back to affect your badge.
Mm-hmm.
All right? Excuse me. It will come back to affect your badge. Please speak up. I will share this experience with you quickly as I round up. I have one more slide to go. There wasn't even planning to speak this long. Um, I started my first travel assignment was to work as a charge nurse, night shift, for a night shift in a facility in the level one trauma hospital. I did not know what I was heading into. Level one trauma. And you are going there as a traveler. And I'm going there to work as the charge. Oh my God. When I got to the facility night shift, it was as if those soldiers were just calling patients from their homes, phoning them. Okay, you should start having stomach pain now. Your gallbladder should inflame. Start coming. You should start having appendix. Start coming. You should. Oh my goodness. It was a busy night for me. First day, it was because I do weekend, Friday, Saturday, Sunday. So on Friday, I used to have assistant, nursing assistant in my facility. So I have a scrub tech, a nursing assistant. I'm the charge, and I'm also the circulator. So I'll be the one to pick the phone and write, change the work list. The charge nurse, when you get to be here, you understand what I mean. Don't let me give you a story about that. Be the charge, or you can Google it. You can look it up about how to be a charge in the OR. Your responsibility is but so many responsibilities. So I'll be the one on the phone when another surgeon is calling. I have a patient in here. I want to put in the patient in the case. Okay. And while I do that, the scrub tech starts giving, I did 3 Victory, 3 Victory or SH do or something like that, or URC. And I'm on the phone, I was writing something down. The surgeon will say, no, this machine is not working, suction is not working. I'll run there, I'll do that. It was so crazy for me, it was overwhelming. And then the second day, the third day, I did like that. I think the second week, I had one surgery, one case, a trauma case, and the patient needed to go to ICU. The way it operates in my facility is that if you have a patient going to be admitted on the ward, on the floor, or go to ICU anywhere, you need to place order for bed. It's not like Nigeria that you use your trolley, whatever trolley you use, and take the patient to where they are going. You need to order for a bed. So they will bring the bed to the OR and they will now transfer the patient onto that to that admission bed. And that patient will be with that admission bed to ICU. Of course, because the ICU bed is different from the regular med-surg bed. All right. So because of that, that particular day, so I only have nursing assistant on Fridays only. Saturday, Sunday, I don't have nursing assistant. So I'll still do my scrub tech and I, if you are free, will do the work of nursing assistant. That's why I'm telling you that this is different from one facility to another. So prepare your mind anywhere you find yourself. If it is you are comfortable with it, yeah. If you are not comfortable, speak up, please. Talk to your recruiter. Tell them what you are facing there. All right? Okay? Speak to your manager or your preceptor, whosoever, and they can help you escalate things. If it's going to affect your patient, always speak up. If it's going to affect your health, don't shy away from telling them. All right? So I had to leave my patient on the operating table, the patient that is not stable. This patient wasn't meant to go to ICU before. So the OT, the surgery, everything, the patient just changed, condition changed, and the anesthesia team were not comfortable extubating the patient. The patient needs to go to ICU. So ICU is on the 6th floor, and my operating room is on the 3rd floor. So there was no nursing assistant to go and bring the bed. So when you place the order for bed, you have to go bring the bed. The ICU team will tell you, okay, we have room 530 something for you. And there is a bed in that room. It is that bed that you need to take to the OR and put the patient on it and use it to take the patient back. The patient doesn't need to move from one bed so many times. So that's the policy for my facility. It may be different in other hospitals anyway. So I had to leave my patient on the operating table with scrub tech and CRNA. And I ran upstairs. Sometimes the elevator may be busy and you have to stay. So I ran through the stairs. But I can't bring the bed with the stairs. I have to come down because I was so scared that what if it happens that something happens to the patient in the room? And they asked me to come and say my own story. I wasn't in the room. I was somewhere here doing another person's job. It is not my job to run around and grab the bed. But that was what the system has in place for me for weekend. But because of I've been trying to adjust with every other thing, like I said. But when it comes to patient safety, I will always speak up. There is no way. No, you can be anywhere in the world. America is so easy. Like I said, you can sack them. They can also sack you. They will even tell you before they sack you. And when they sack you, they will not tell you the reason why they sack you. They just tell you, don't come tomorrow. I'm not scaring you. You two can tell them that I think I'm done enough with you guys. I don't feel you guys, I'm going. And you can always go to any other place if you have a genuine reason. All right. So by the time I brought the patient to the room, thank God nothing happened to the patient. So the next morning, I went to meet my manager. And I was holding my badge. Okay, I have one of the badges. Maybe this was the badge I was even using that day. This was my old badge. And I told the manager that I don't think I can do this anymore. Would you mind giving me a nursing assistant to help me on weekend? If you cannot do that, I don't think I can do this shift anymore. And she said, no, please. The person said, that day, manager said, I think you can, even you've been trying for 2 weeks, you can manage while we get things in place. I said, so I cannot manage. Then I brought out my badge was like that, like, I cannot do anything that cannot protect my badge. That what came out of my mouth. My mouth. When I said, with due respect, ma'am, I cannot do anything that cannot protect my badge, please. And she looked at me like, oh, This boy is serious. Oh. And because of that, they do not make any changes. I told my agency that I'm not going to work tomorrow. And my agency was like, what happened? I explained the story to them. And because of that, I left. As a traveler, I was supposed to do 13 weeks contract. I did maybe 2 weeks or so, 2 weeks with them. And I stopped. It was painful to my recruiter because, they would have been planned made money on my head. Everybody's making money on your head, which is good because everybody's creating opportunity for us to even have a good life, which is good. So, um, so I was like, okay, I left. And do you know that it was this same facility that sent a text message to me that, hey, Josie, would you like to come back to our facility? We have a new opening for you. They did not because I spoke up and what? And said that boy can never come here again. That's some hospitals when you work with them, they will put it on your name, not to be rehired.
Yeah.
Not to be
Sorry,
rehired. If they hear your name anywhere, nobody will rehire you it. Price come.
I'm telling you.
Right? I'm
Yeah.
telling you. You may not even know they've written something like that, and they'll be smiling at you. Hey,
Mm.
how are you? How are you doing today? I'm telling you, people that work in the UK will understand. Maybe things that happens there about people's, it's still part of culture. Somebody will smile at you now. The next thing the person is going to report you. Why is smiling at you is going to report you to your manager. Maybe you
Mm.
do not do something. And that is why when you notice that the soldiers this, and you understand, and the system is giving you opportunity to be trained. So when you are trained, you need to retrain yourself. You need to go extra mile to train yourself. I tell people what makes the genius. It's not just reading the book or those gifts, but it's the ability to go extra mile, to do something extraordinary. So
Mm.
that is why. So you need to read again, you need to study, you need to watch video, you need to watch YouTube. Especially with that, we travel there as travelers. When you get to some facility, they have maybe 1986 equipment. You have to look it up quickly on YouTube to understand it sometimes. Then or you call somebody to
Mm.
show you how to do it. Nobody will say, why don't you know this? Nobody will tell you. Always ask, and people will be there to teach you. And if you're not comfortable with any procedure, speak up, and they will tell you. And that is why by the time you complete your contract and you begin to work, there is always credentials and competency. They will assess your competency and they will ask you which which area of specialty are you more comfortable with. Then you need to tell them I'm more comfortable in neuro. And they'll put you in neuro orthopedics. They say that, oh, I'm more comfortable with general surgery. They put you in general. They will never from general be taking you to neuro. When you're a general team, you're a general team, right? But when you are a neuro team, you are a neuro team for the most of the facilities. But sometimes now, because of that shortage, because America is waiting for you people, they do not see anybody to help them now. So that what facilities do now is to cross-train. This is, am I right?
Yeah,
Is
you're
to
right.
cross-train people among ourselves to put a general nurse on neuro team for some days. So that when they are short, they can bring in that person.
Replace.
But we are getting overworked.
Mm.
See now, I left 2:45 a.m. I've not really slept too much. I also have cold and kata. So we need you to come and relieve us.
Yeah.
We really need you people, and I know that you guys will want to come. But I believe
Mm.
that, excuse me, I believe that the government, let's keep praying. By the time retrogression is lifted, we were in your shoe before. I must tell you, I was just like you. This essay was just like you. We were waiting. I was like, for my wife, because my wife came in as the primary, right? So we were like, every time I check the emails, any email from the agency, any email, and we were like you, looking into our emails every second, every minute. And I know that your own time is almost here. All
Mm.
right. So I just want to encourage you today that uh, you have done the best part of this journey, which is passing your exam. Congratulations. And for those that have not written their exam, they are waiting to write their exam. I wish you success, in preparing for your exams, So you are not just like somebody who is just somewhere there still thinking about do I need to do this? Do I need to even try? Because it is not about do I need to try? It is about you trying. And that's what makes difference in the individual's life. You need to keep trying. Even when you fail, you need to keep trying. I've failed in many ways before. I've failed in different things before, right? So, but if you fail, you carry yourself again, you stand up, and you keep moving, all right? So, create time for your family, your faith. It depends on you. Don't joke with your faith. When we talk about cultural, there's something we call acculturation. Acculturation. I know you understand that acculturation, where you travel to place, you start learning how to eat their food. You are trying to blend with them, and you are there. With time, you get used to their system. Then that's what they call acculturation. Acculturation. So don't let the system here influence you. I don't be like wanna be. Hey, wanna be people, don't be like that. All right. Just be yourself. All right. Be yourself and have fun. Don't forget to join professional association. It is important that you join professional association when you get here, because that's where you get to know the things that, because things are changing. And with that, you can better the practice in your facility. You can be a change in your facility. I was opportune to implement a quality improvement project in my facility where I work. It has become a system-wide, as I accepted a kind of policy in terms of surgical smoke safety, you know, in my facility. So it's one of those things that you can do. You can bring in different things. You can join research team. When you come to the US, please, I'm open. Let's do research together. One of those things we are missing in Nigeria. There are many research areas we can do. You already have a lot of research gaps in preoperative practice. They've listed it. They can sponsor you. You can win. You can win grants, right? You can win grants. You can win scholarship from AORN. So it's just for you to participate in research. And America gives the opportunity to advance your career, right? You can decide to, uh, sorry, you can decide to advance your career. You want to become a doctor of nursing practice. Maybe you are interested more in the maybe quality improvement project, evidence-based practice, and even research, because there's a difference between research, evidence-based practice, and the quality improvement project. All right. Even though the three of them can meet at some point. And if you want to have your PhD, you can decide to have your PhD. But what I want to say about career advancement in terms of spending money, you are going to owe a lot of money. You're going to pay school fee, because America will not sponsor you, because if you already had your first degree, they won't sponsor you, because they sponsor most of their people with first degree. They give like scholarship. But if you have had, because they want to encourage their children to go to universities. But your master's, PhD, you may not get scholarship. So if you want to have scholarship, you know that you are finishing your master's, maybe before leaving Nigeria, while you are waiting, you can decide to apply for scholarship, PhDs or master's scholarship. You should be able to get it from Nigeria. But when you have your social security, you are limited, all right? Because they believe that you are in that category of people in the US that earn decently, okay? So they might not give you scholarship. But if you want to have, you can apply for scholarship while you are waiting in the US and your scholarship is still here, you can use it, all right? So another thing I want to say about is that doing too much degree is for those people that are passionate about career advancement. I must be sincere with you. What I tell everybody, it doesn't bring you too much money. It doesn't bring extra income to your pocket. And don't be surprised that here in the US, don't say that in Nigeria, people fight for title. That doesn't fight for position in Nigeria, which is so bad, so sad. I'm talking about my country now from my experience. Instead of fighting for profession, they fight for title, right? I want to be the one. So the friends and friends would not be fighting. I have PD, you do not have. I have DMP, you do not have. I have DSNL, you do not have. You have S. Forget about that. Coming to the US, RN is what is the basic for everybody. They encourage degree. They encourage you. They will even sponsor you for your bachelor's. And if some facilities have different scholarship program, you want to do masters, but you have to be signed a bond to work for them for a certain period of year. Okay, but No, that doesn't mean that if you have a doctor who doesn't practice, like for example, where I work now, when I'm not PRA there, and the first person to have doctor doesn't practice there. And when I was doing my doctor doesn't practice, I needed a nurse to precept me. There was no doctor in my facility. So I had to use a surgeon so to precept me. And when I became that, you know that the person that is in charge of our education that give me directive about what I need to learn or not, she has just RN. They don't say because I have DMP, they will now say, you no, send that person away. No. So some people like, I know Nigerian people, for example, when they get without my degree, don't go and be talking to one manager because they should, because you want to prove yourself that you have degrees. So they won't look at that. You will embarrass yourself. I'm just trying to say that. I need to be factual, right?
Mm-hmm.
They let them recognize you by your work competency and your skills.
Mm-hmm.
People have CNOR, this is CNOR. What is the differential for CNOR and somebody that does not have CNOR? Maybe $1 difference.
Mm-hmm. $1. That's it.
I'm telling you this because it's part of culture. Don't think like, oh, because I've read more, I've got certificates, credentials, I should be your guy. Nothing like that. Yeah. It is the discretion of the leadership. That does not mean they do not recognize career advancement. They recognize it, but it's their own discretion of the leadership and they did at that point. If they believe the RN has been there before you came, and that RN is doing well, they will, because of that, change you. And one thing about America is that you are not satisfied with that facility because you are now Oga, you now have so many credentials on your shoulder. Then you can go to lecture, you can become an adjunct lecturer. It's easier for us to do that. All right. You can go to another facility looking for maybe director of education that match your credentials. But don't be the person that will put somebody down here because they
Mm-hmm.
will forgive you. I'm telling you,
Mm-hmm.
they will gossip around you. Even if you are doing good, they will still gossip around you. Expect that. I'm telling you things that you need to know. They will gossip around you. They will gossip around you. With time, they will get used to you.
Mm-hmm.
So if you do good, they will say it honestly that this guy is good behind you. If you do something bad, they will gossip about you. Yeah. But don't feel bad. It is normal that they gossip about us, right?
Mm-hmm.
It is normal. So they will gossip about you and things like that. When they gossip about you, ignore.
Yeah.
Because what is important to you is your paycheck. What is important to you first is your paycheck. What is important to you next is your paycheck. And what is important to you is your family.
Mm-hmm.
It is not about what people say around you. So I want to congratulate you, my colleague, and like put it there that your visa will come and your flight will take off. They are not wearing white uniform here, you know, but you wear your scrub, you wear every scrub that you need to wear, you wear your scrub, when you wear, if you are an educator, you wear your white coat. If you're a nurse practitioner, you wear your white coat, you wear it around, all right? But success is not defined by geography. It is defined by what? By growth. So the
Growth.
US is your dream destination, yes, but your purpose is global. You are not just nurses, you are ambassadors of healing, architects of hope, and career of excellence. Thank you so much for having me, and I will wait
Thank you.
for.
Thank you. Thank you. Thank you so much. Man, ladies and gentlemen, you have heard from not just a professional colleague, but a scholar, a professor in practice, if I will give you that title now. I think you are the one that deserve it. You deserve that. You deserve
We are
that
still
one.
doing.
You're very thorough and detailed, and you went above and beyond to dish out this very cumbersome, like it's so big, a big topic that we gave to you, but you were able to, put it all together and dish it out. And the way you presented it, it was more like you gave us like a real life experience. Everybody that listened to you or is already feeling and seeing themselves in the United States, practicing nursing, facing those challenges, and employing the measures that you're teaching. And you did this even without, feeling well, like with your code, you were able to still deliver. I don't know how else to tell you that you are appreciated. Thank you so much. Thank you. Such a great person. And
Thank you for having
I
me.
was listening and I was about to give you a notice and say, can you cut it so that we'll bring you back next week so you finish up because I know you had a lot to download to us, but
Sorry.
we're
I
able
know
to
I was gonna
get
be a
all of
free. I
them.
thought it was gonna be a freelance, no time given to me.
Yeah,
So, but it was
yeah,
fun.
I know.
I enjoyed having this time with everyone. Yeah,
Honestly, this is a good time for us. We actually enjoyed every session. And I can see a lot of people saying thank you. But guys, we don't say thank you. We just put value, guys. So if you know you got value for the session, if you know you got value for this time that Dr. Johnson has been with us today, please kindly go on the comment section and just write value plus however time that you know that will make you feel good. So just put it on the comment section. And we have somebody here. We have a very good friend. He's one of us. He gave me a very good treat when I came to Texas. His name is Sammy. Sammy, how are you doing today? Good to
Samia,
have you.
Odogu, Odogu, I'm loyal, sir. How's
Yeah,
everything? Thank you very much,
yeah. Good
Dr.
to have you.
Johnson, for the
Samia.
presentation. I was part of it. I saw it on Facebook. I was like, oh, I think I should join this thing. And then I looked at the time. It was 6 p.m. Nigerian time, 12:30 my time. I just got out of a test. I was like, oh, come on, let me just hop in. And I've been
Thank
That's
part
you.
of
good.
it. So thank you very much
Thank you
for the
for
informative
joining.
session, boss.
Thank
Thank
Keep
you
you,
it
so
up,
much.
Sammy.
Chief
Thank
Thank you,
D.
you,
Sammy.
brother.
Good to have you. Good to have you. And then say hi to the family for me. And before
Thank you,
we let
boss.
you go, I would like you to drop a word for my people. I would like you to drop one word for my people.
Absolutely. Yes,
Yeah.
Samia is
Yes,
a
we got
first
it. We
time
got you
stronger.
today. You're
Platform,
not you go nowhere.
platform. Yeah.
Anyways, since my chief has spoken, I don't think I have much to say. But most importantly, believe in the dream. It is worth it, no matter how long it takes. Someone asked a question earlier on asking if someone can do this process at 55 years old. Back in 2018, 19, while I was in the process, then there was a matron from UCH. Uh, she was an ADN, I think, aspiring to be a DDN, who someone linked to me to help to like just scale through the process. I can assure you, this matron was here during COVID. She made COVID money. You know what that means.
Oh my God.
And then
All the
she's
business
good. She's
today.
living it.
All the,
So age is no barrier. Basically, it's so just keep the dream alive, and it's
Yeah.
worth it. Do you
worth
understand?
it.
And I wish us all
Absolutely.
the very best. While you're waiting, get things to equip yourself, sharpen your skills,
Oh,
learn skills.
we have one ADN here from Madam Bolanle 52. Yeah, that's great. Welcome, Madam Bolanle. I think I saw that. ADN 52. That's great. That is passion for what? Passion for life. Keep dreaming. Keep dreaming. Keep dreaming.
Thank you. So while you are waiting, you learn skills, sharpen your skills, learn things even beyond nursing that will help you. Nursing is beautiful on this part. I've worked in the UK before. I'm here now. I've worked in Nigeria, of course. I think I'm living my best nursing life at the moment. It's sweet to go to work for 3 days in a week and then you come back, relax, and you have the time in the world to do whatever you want to do. And just
Mhm.
just dream big. It's possible. It will happen. Just a matter of time.
Awesome.
Yeah.
Awesome. I wish I can give you more time. See, I'm not talking. I'm giving you more time because I know you
You
have
have to bring
you have a
you
lot.
have to bring it, you have to bring
You have
him
a
back.
lot.
You have to bring him back
But
to
it's
talk
okay.
about
It's
fun.
okay. We are coming for
I
you. Okay,
appreciate. I
Sammy.
appreciate.
Sammy, I'm
Thank
coming
you.
for you. Okay, I'm going to be in your DM. One of these days, I
Anything
think
for
we
the
are pretty
boss.
much fully booked for this month, but I'll look at next month and see where we can get you in because I know you
Anything
have
for the boss. Anything
you
for the boss.
I know you have something
I
to offer.
appreciate.
So let's bring the spotlight again to you,
Respect,
Dr.
sir.
Johnson. I mean, there's been a lot of thank yous and values on the comment section, but that is just our own way of telling you that we appreciate you being here. We appreciate your time. And then I don't know, there's some questions that came in during the session. I don't know if I can dig them out, but one of them, if I remember correctly, was someone was asking, in the operating room, is there a clear path between like someone who wants to go further and become a robotic surgery specialist? what can the person do? How can the person get into that field? So I don't know if you want to throw one more, like a more insight into that. If there's any
Absolutely.
training or anything that needs to be done before somebody
Absolutely.
becomes. Yeah, thank you.
Absolutely. Absolutely. Thank you for that question because I myself am passionate about robotic surgery. So the pathway is this. Uh, so if you work in on a general team, then you have the opportunity of learning about robotic assisted surgery. That does not mean they don't do robotic neurosurgery, but it's not like the robots they use in neuro is different from the robot they use in general surgery. And we also do robotic, what do you call it now, robotic knee replacement in orthopedics. It's also a robot. It's called ROSA. So it's different. So, but when you're talking about robotic assisted surgery, what comes to people's mind is the Da Vinci robotic system. And that one is used for general surgery. When they say general surgery in the US, if we are working on a general surgery team, it means that you work in a general surgery that we know, everybody knows about that. Like doing laparoscopy, breast surgery, doing anything, somebody has a cut, you suture it. Then you do urology. You will do ENT,
Mhm.
ear, nose, and throat. That's ENT. You're also doing oral maxillofacial surgery, OMS. All right. You are also doing plastic. So general surgery team, general surgery, it encompasses all these subspecialization areas of care. But we have neuro. Neuro is always on its own now. So if you're a neuro nurse, you get more pay. All right. You get more pay for neuro because they believe you do it. You get more pay than general surgery. Even though general surgery, you are like jack of all trades, you still work around other places. But don't see it as a jack of all trades because it has its own advantage at the end of the day. Because you'll be able to do so many specialties on your own compared to somebody who transitioned from Africa and put in neurosurgery, and you were in neurosurgery throughout. They train you in neurosurgery throughout. After you finish your orientation with the facility, then it means that you'll be working in neuro. Then I say you decide you want to travel, you won't be able to work in other specialties if that is the only available specialties that is available in the market. So, but for the robots, you have to be on the general team for you to learn about robots. You want to learn about robotic surgery. The reason is this: the general team allow you to do general robotic surgery, bariatric robotic surgery, urology robotic surgery, GYN robotic surgery. Okay, and that is what I'm doing right now. So, so now you can use you can do robotic assisted general surgery cases. You can do robotic assisted weight loss surgery cases. I don't want to mention the terminology for those people that are joining us. You can also become very good at robotic assisted urological surgery. All the prostatectomy, you do it robotically this time around. You know, hysterectomy. Nobody is opening any patient anymore because they value their stay. They want that small incision. They want to go to the beach. Last time we were at the Virginia Beach, so they want to show their body in the beach. So that's why. So the career path for robotic surgery is that you do your CNOR. When you do your CNOR, then you are not going to write any exam to become CNOR robo.
Mhm.
CNOR robo.
Mhm.
So the CCI credentialing and competencies institute, they are now giving the certificates for anyone that specializes in robotic cases. So when you do your CNOR, the only thing CNOR is by exam.
Mhm.
Becoming a robotic certified nurse does not require an exam for now that I know of. You can become CNOR pediatric. You can become CNOR orthopedic now. And that's why America is trying to create different niche for people based on your passion. And you can just stay there. You don't have to do everything. And you can have time for other things for your family. So for you to become a CNOR robo, all you need to do is to pay a token and fill a form and document that you've been working in the robotic surgery room for so number of years, or you've met a particular required number of hours working in that place. And when the CCI team, they will look at everything, they will verify it, and if they know that you merit it, they will approve you to become a CNO and a robo. Does it bring extra money? No. Yeah, no.
Just title.
So, title. And I know Africa will like title. I have titles. I love titles. You know,
yes.
I don't like titles to boast. But otherwise, I would not be telling you this.
Yeah.
If I so much love titles, I just like to read and advance my career. But it doesn't bring extra money. So if you are a guy that your wife is going to ask you, like my wife, how much are you bringing home? how much will that bring to our house? Yeah, we have that kind of a wife.
Yeah.
Before you begin to spend your money too much. But it's to advance your career based on your passion, because it's something that you are passionate about, that you do well and excel in it. We are passionate about nursing, and we are doing great. We are not there yet where we want to be. You can still diversify. You can be a nurse. And let me tell you another thing that is important here. I have a friend that worked in the OR by coming to the US, but now a mental health nurse. You can switch anytime, because the system gives you the opportunity to be where you want to be, to become what you want to become. And that is why it's different from where we are coming from. It is different. Even when you have the knowledge, you have the passion, what's the supporting system? The supporting system is not there. And that is why we are praying that everything should be better wherever we are coming from. All right? And when we get here too, we want to go back. Decency, we'll be talking about going back to
we talk about that a lot.
A lot. So that's the question. Any other question?
Yeah, so there's been a lot of greetings. People are so thankful. And then the last question that I have is, and that will be the last for today, is what's the process of switching from registered perioperative nurse to nurse anesthetics, and how is nurse anesthetic practice in the OR?
Thank you so much. So for you to switch from a perioperative nurse to registered to become a CRNA, they have their own pathway. And their pathway is both clinical and academic. So most of the CNA program now, when you are enrolled in a CNA program, you do it if you have first degree before, good. If you're in the first degree in nursing before that, DSN here in the US, good. But you need to go back to school. You need to look for a school that will admit you, that will take you. Then most of the school require you to have been working in ICU. In fact, for a minimum of 1 year. But majority of the schools require 2 years. Very few schools will take you with 1 year experience in ICU. So if you want to transition from a perioperative nurse into CRNA, you need to leave the OR for a minimum of 1 year, or maximum of 2 years, if I may put it that way. You need to be working in the ICU. That's one. And that is when you will now begin to apply to schools. Because one of the requirements for your admission into any anesthesia program is that you must have been working in the ICU. You cannot be qualified as a perioperative nurse. All right. And there is nothing like registered perioperative nurse in the US. You know, that gave me problem when I was doing my CGFNS. They could not evaluate our perioperative nurse in Nigeria, but they have nothing like outbound here. Until I told them to remove it, because I spent like almost 1 year plus waiting for my credential to be evaluated. I was calling from Nigeria. I know how many of you call CGFNS spending a lot of naira. The credit will finish. You start all over again. So they're not like outbound, they don't know it. Recently, I was giving a lecture at AOR and I wrote outbound, I wrote PGE, postgraduate diploma in education. They were like, what does that mean? I just say, do you mind taking that off for the sake of people to understand? I said, I don't mind taking it off. Can you imagine what we went to perioperative nursing school for?
Your sweat.
And they said we should remove our sweat. So, but CRNA is a fantastic a program is worth investing in.
Mm-hmm.
Is worth investing. Yeah, guys there. Decency can tell you more about it. It's
Oh yeah.
more invested, must invest in. There is good return on investment on it.
A lot.
Because you get good pay,
Mm-hmm.
and your work is it's like you driving a car. It's more than that anyway. Because
Yeah.
anesthesia is like somebody driving a car, starting it, and when you get to the time the patient to wake up, you match brake, right?
Mm-hmm.
That is
Mm-hmm.
anesthesia. If you can just take anesthesia that way, you're going to be a good CRNA. All
Mm-hmm.
right. So that. So it is critical. You have to be in ICU. So if you're planning to eventually become a CRNA, prepare your mind that at some point you have to leave the OR completely for 1 year and go and work in ICU. But you can still be doing your OR per PRN, and because you still need money, right?
Yeah.
But for you to be qualified for admission into anesthesia program, you have to have that experience in the ICU.
I
So if you are
see.
willing to do that, that's good. Then depending on the school you are looking for. Some school takes 1 year experience, some school insist on 2 years experience. And you have to do prerequisite. You have to do another prerequisite courses. It's like you have to do like your anatomy or some things, physiology, because it's more physiological, right? The
Mm-hmm.
drug, pharmacology, pharmacokinetics is more
Mm-hmm.
physiology. So you have to do all that. And the program differs. Some will just allow you to become CRNA, but most of the program is now from RN to Doctor of Nursing practice in
This
anesthesia.
anesthesia,
So
that's true.
that if you know that you want to become CRNA in the US, you know that your goal is to become a doctor there, because most of the program is like you,
Doctorate.
you must become a doctor in it.
Yeah.
So yeah, I hope I'm able
Wow.
to answer that question.
Oh,
But
you
it can
did.
also, because it differs from different school
State to
requirements
state.
and different state laws.
Mm-hmm. Wow, thank you so much, Mr. Johnson. Thank you so much. We really appreciate you. We've not had a session this impactful, I would say. It was really, really impactful. Thank you for pouring out your heart and giving us the best of you today. We really appreciate. Yeah, I'm just going to take a quick moment to give some immigration updates. So for some of you that has been, sending me messages, asking questions that I told to come for this session. So there's been some information concerning the transfer of cases from country to country. Majority of our people have transferred to Cotonou. Some people have transferred to Cameroon and Ghana and the rest of that. So, but there is a new change. There's a new change. One thing you will understand is that I came out here and started encouraging everybody to transfer. That's like 6 months ago. And a lot of people, even yesterday, some people have been getting visas, those that transfer their cases, because Lagos Embassy is full and they are not issuing appointments. So for those that transferred, there's a new law from November. I think from the first week of November, they will stop, issuing visas on the spot for people that transferred. So what they are trying to do is like if you transferred to your case to Cotonou, what they are going to do in that month, they will first of all treat all the Cotonou citizens first, then they will come to those that have permanent residence. And I know most of you will get permanent residence in Cotonou or Benin Republic or anywhere you go, but they will still treat you last. So even if you qualify and they are able to say they are going to give you a visa, you will start seeing from November, you're going to start seeing a lot of AP. AP means administrative processing, which means they're going to place you on hold until they give everybody they are supposed to give. If there's any remaining slots, they will give to you. So if you want to take that kind of chances, you can continue to keep your case there. But if not, I would say if you have not been responded to, if you have not transferred your case already, please just stop transferring for now. Let's monitor the process and know what they are going to do with those that have already transferred. So from there, we'll now know, next, decision or next advice to start giving out. So, but from me, they've been sending out messages saying that if you transferred your cases, you're going to be treated, kind of last. Some people have received that email from the embassy. So I just want to make you aware of it. In case you receive it, don't be anxious about it. It's just a normal process. They're going to treat citizens of that country first, and then those that are permanent residents. And I want to say something again. because I've seen people go to the embassy and then just mess everything up. Please make sure that your story is very straight. You cannot claim that you are a resident of a country and you're working in another country. That's another problem that came out recently. So most of the people that, if you want to say I'm a resident of Benin Republic, for instance, you have to be either working there or claim some sort of business or opportunity that you're doing there, something that makes it legal for you to stay in that area. But if you come and say you work in Lagos and you're living in Benin Republic, it doesn't really make sense. So really, I want you to build your case very well before you approach the embassy. If you need further assistance before you go for your visa interview, please kindly reach out to me or reach out to my assistant so that we can get a slot. But most times I'm always very busy. Answering call has actually eaten deep into my family time. So I want to see how I can moderate that. So if you reach out to our number, the number on our flyer, they will try and get a slot for me and you to have a very fruitful conversation about your visa interview. So the next thing is about H1B. So for H1B, there is a new law that, for anybody to get a H-1B now, they have to pay $100,000 to the US Embassy, and that is per applicant, not per company. It's per applicant, and most companies are not going to do that. So if the only company you have signed up with are promising you H-1B and you don't have any other alternative, I want you to start looking for alternatives now. Okay, don't bank on that because they might come out last minute and tell you it's not possible. So start now to look for alternatives. Start now to look for how you can get into another company that can do an EB3 for you. If you don't have any company yet, come to me or just reach out to us on our email or on our phone number on WhatsApp. We can get you an offer as soon as possible. Just let us know. And then if you have any company that has, because I know I don't want to mention name, but there are some companies that came up recently and started issuing people like a dismissal letter. They are not working with you anymore. You can find, and this is like after 2 years of you being with those companies. If you have been dropped by any company, you can reach out to me as well. We can find a way to recapture your I-140 and then continue your process without you losing your spot in the line. Because most of those companies, what they did is when there was a lot of backlog of people, they took on a lot of people into their program, and most of the hospitals they are working with are now saying the process is taking long and they cannot wait for that long. They are stopping all the international processes that they are doing. So those companies are in turn coming to tell you that they're no longer going to sponsor your visa. So we can actually I've talked to an agency. We are partnering together. We are able to recapture your priority date and still make you not lose your time in the line. And then if you have B1, B2, and you have taken your NCLEX and you intend to come to the US, there may be possible options of an adjustment of status somewhere down the line. So if you want to do that as well, you can reach out to me and then we can talk about that. Okay, that's all I have for the announcements. And then we are going to come back to the meeting. So guys, I know we still have a lot of people on the comment section, and I just want us to do. Someone raised hand. Is it Johnson?
I'm the
Johnson,
one. I'm the one.
okay, go ahead.
Yeah. So I think I look at the comment, the chat box now. I see somebody is still insisting that adults anesthesia practice in the US. I think maybe I didn't answer that question. If you give me just 1 minute to say something about that.
Okay,
So the
go ahead.
practice of CRNA anesthesia in the US it differs from maybe from one state to the other. But one thing I've observed as a traveler, I haven't traveled working in different hospitals, is that there's some facilities where they have CRNA and the anesthesiologist, that is the MD. They have that, and there are some facilities where they have just anesthesiologists, which is a doctor, MD. And I work in another rural surgery center. Rural surgery center, they do not have anesthesiology as a doctor. The person that puts patients to sleep, everything is what CRNA. So it depends on your state. And there are different state law that governs every practice. It's not like Nigeria that maybe you have one law. State laws differs here. In fact, it differs in everything, in system, in practice, So you need to understand the state laws. When you get to the US, all these things are available. When you go to your state website, you will see a lot of information. There are different bills different bills and they've passed concerning patient care, putting patient to sleep. So the CRNA, you may have CRNA and the anesthesiologist in the room. Most of the time, CRNA will be the one to start the process, get the patient ready, and the anesthesiologist as a doctor will be the one to push propofol. That is, I'm not saying that is the only thing they do, but that is the only thing I see them most of the time is in a particular facility. They only come with propofol to give. So they may have just maybe 2 anesthesiologists or 5, but they have CRNA, they have like, there was a hospital that I worked, they have like a 35 operating room for neuros and orthopedics, and the 40 neuro intensive care units. So they have intensivists, but they have 2 anesthesiologists that I know comes to our own area because they do other specialty, but neuro and orthopedics alone was 35 operating rooms. So the anesthesiology will just walk around from every room and just push propofol, leave, push propofol, leave, push propofol, leave. So the CRNA will be the one to do everything, putting patient to sleep, patient emergence, and estimating the patient. So that's what they do. All right. So is it work shift hectic? Actually, that's another angle. Well, it depends on your definition of hectic. If you have a patient, not when sometimes in the OR, if you have that even back home, that sometimes we are very busy, that sometimes we are not busy. All right. But if you work in a level 1 trauma hospital, you expect that you will be busy. If you work in a level 2 trauma hospital, you will be less busy. If you work in rural surgery, you may finish your surgery by 12 o'clock, right? So you may have maybe 2 cases in the morning and finish 12 o'clock and you go home. That's rural surgery. So that's that. So it varies. That's what I will tell you. I will not tell you specifically this is how they practice it, but it differs from one facility to the other, and it different from one state and their own scope of practice. All right, because I've never worked as anesthesiology, but from what I've observed and from my relationship with them, and what I know is that some facility will have the anesthesiology and CRNA in the room. So CRNA will always stay in the room before you go to get your patient. So once patient comes to the room, the anesthesiology will come in and ask the CRNA, do you need any help? You say yes or no. Yeah, they will support you. And sometimes before they get to the room, because they might be in another room where your patient is there, you have done your intubation, the patient is asleep, they come to the room and they just ask everything okay, say okay. They just say thank you and they will go to another room because they move around. The anesthesiologist, the doctors move
Yes,
around.
yes.
But but you as a CRNA, you need to be trained to be what? Self-sufficient on your own. That if there is no doctor, you should be able to manage situations pharmacologically. You should be able to manage situation with your drugs because CRNA is not about drugs, right? You know the right drugs at the right times and things like that. You should be able, that's why they need the ICU experience. All right, so that's that. That's a particular facility they use only anesthesiologists, no CRNA. So the doctor will follow you to go and bring patients. Sometimes you put the patient to sleep, you win the patient again. And I've been to a facility to do CRNA. They gave them opportunity to do more than CRNA work. What do I mean? They allow them to give injections, spinal. I mean, they do like a local injection and all the rest like that. So that's all I have to say. So, but if you can't just open your mind and you ask more questions, ask from your immediate environment, people will tell you more about what operates within that facility where you work. And from there, you can just leverage. So learn and unlearn. If you might be practicing anesthesia in Nigeria when you get here, try to learn and unlearn everything you've learned about. Just throw it somewhere before. Keep it somewhere. Learn afresh. And then from there, you can now begin to benchmark what you know before and what you are learning anew. Thank you so much.
Awesome. Thank you so much. I really appreciate that. Thank you. Thank you. I'm afraid we won't be able to take much questions again, but I'm promising you, by the grace of God and by the benevolence of Dr. Johnson, we will bring him back again. We will bring him back again. I know he would. He would not say no. I
We
know.
bring,
I know.
you
He
bring,
has a good
we
heart.
bring, we bring Stanley Young first. You
Yeah.
tell us the people, the UK transition history too for people
Yeah,
that
yeah,
are
yeah. Definitely. That story is worth sharing.
for
We're
sharing.
going to
I
do
have a
that.
lot of UK people here. Yeah.
Yeah.
I love you.
Exactly. That's true. So thank you so much, Dr. Johnson. We really appreciate you. There is one more exercise before we go. We always learn languages because we come from different backgrounds. So a lot of people, I saw I think some people from Zambia are here today. So I just want, they're going to say thank you in different dialects, and then you will read it out for us. Let's see how good you are with languages, something like that. So, so
Uh,
they have started because they know the drill. So when you say thank you, you tell us where it's coming
okay.
from. Okay, please always remember to tell us where the language or the thank you is coming from,
Na,
so that
Nagode is Hausa. The person put the
okay.
answer there already.
Okay, guys, let's pour it in. Okay, we're waiting. We're waiting. Dr. Johnson is waiting.
Dalu, that's Igbo. I know that, of course.
Okay.
Ah, Obulu, I don't know that one, though, please. Is it data? Is this data?
I think it's that. I don't know. Please put the country. I mean yeah. See, put where it's coming from, where the language is coming from. Okay, say they do. Yes.
Edo, oh my God. And I've been on many million to Edo many times.
So we have someone from Burkina Faso here, Florence.
Oh, merci, they're French. Burkina Faso, they speak French. Merci
Yes.
beaucoup. Merci
hmm
beaucoup.
hmm So keep it coming, guys. Keep it
You
coming.
say Ngas language, Obulu Eson. Uh, Imela, Igbo, yeah, of course. Imela. Ways a minute. Gracias, Mexico. Of course, if you work in the US, you will like that gracias.
Yeah, you like gracias.
Our, you like gracias.
I have someone from Kenya,
Asante,
Patrick.
Kenya. So good. Imela,
Okay.
Igbo.
Okay, guys, thank you
You guys
so
finish.
much. Thank you, thank you, thank you. You pass your language test. We are going to send your gifts to you, okay? All right, thank
Thank
you,
you, guys.
Johnson.
Thank you
We
so
really
much.
enjoyed,
Thank
we
you
really
so much.
enjoyed you here. We
Thank you.
enjoyed
God bless you,
ourselves with
guys.
this session.
Yeah.
God bless you, and to
Thank
you
you.
all that listen to us, that stayed true to the end. We are so happy. We hope to see you guys. We always here every Friday. So keep a date with us next week Friday. We have someone coming from Texas. He had a very unique nursing journey to the US, and we're going to be bringing him here to share his experience. I believe he's going to encourage one or two person. So by the time the flyer comes out, we're going to share it in all our platforms. So keep a date with us next week Friday. Come here, it's going to be awesome. And then just remember, this program is brought to you by the vendor of good news, the Decency NCLEX Academy. Always come here every Friday. We can encourage ourselves, give ourselves some little information that we don't know about, and get ourselves ready for the big future, the big reality that is coming. Very soon you'll be in the now that we are talking about. You'll be in the future, and we want you to be ready for it. We don't want you to get there unprepared. I bet you most of you that are saying we are in retrogression, if I hand you a US visa, you tell me you're not ready. I'm telling you, you will say, most of us, when we were preparing, by the time it was like tomorrow, we are like, can we go next week so that we can get time to handle? So all those things you want to start handling, start doing it now, okay? God bless you. I'll see you all next week. God bless you. Thank you, Johnson. Thank you,
God
Sammy.
bless
God bless you.
you.
All right. Yeah,
Sammy,
bye.